Okay, good morning, and this meeting is now resumed. Members, please join me in a moment of silence to remember the following persons who have passed away. Sam D. Abolio, Nanak Natyak, Sasha Hashi, Rabbi Yitzchak Gersner, Alan Wayne Scott, and Michael Jonathan Wyman, Anna Aviva Wyman, and John Kennedy Wyman. Thank you.
Speaker, you cut out a number of times when you were speaking. I wasn't able to hear all of them.
Oh, my mic is on.
I did. Just,
Did nobody hear me?
I heard you loud and clear.
oh, yeah.
Okay.
It was gone.
Members, we will now review and confirm the order paper. There are 45 items left on the agenda, including 30 member motions. Council has decided to consider items HL 25.3 and HL 25.5 on response to COVID-19 January 2021 update in the student nutrition program, update and resource needs during COVID-19 as the first and second items of business this morning. Council has also decided to consider item CC 28.10, LPAT appeal of official plan amendment 231 by Park Downsview Park and Canada Lands Company as the first item after member motions this afternoon. Members, yesterday council set a time to consider item IE 19.11 on Young tomorrow. Municipal Class EA on Young Street from Queen Street to College Street, Carlton Street, but we ran out of time before the recess. I propose that we consider that as the third item of business this morning. I will now take the release of holds. Please put your name on the list if you have an item to release. And I've also reviewed an urgent motion to be added to the agenda. Are there any release of holds? No? Okay, and Councillor Layton, we have your member's motion now prepared, if you'd like to introduce it.
Bolts.
Councillor Layton?
A difficult time with the emotions on screen. You assume this is my opportunity to introduce a motion for 103rd Zebra Street West, an application to alter character attributes noted there.
Okay, can we just vote on this first? Okay, I think we're going to have to recess the meeting because we're having technical issues. Okay, yeah, just briefly.
Point of order. Speaker. Speaker, I don't know whether it's on my end.
Yeah. Okay, we're going to take a few minute recess at this point, okay?
Should we all disconnecting and reconnecting, Madam Speaker?
Okay, thank you very much. I'm going to recommend that we recess to 11 o'clock because we do have some technical issues, and we want to give the staff an opportunity to correct those issues. So we'll recess to 11 o'clock. Thank you, and sorry for the delay.
Thanks, Madam Speaker. Good luck, guys.
We'll go live to YouTube in a minute, and then the speaker will reconvene the meeting.
So, Councillor Filion, my audio and video.
Okay, thank you very much. I apologize for the delay. So what we're going to go back to the item that we were at, and Councillor Layton, you were introducing a member's motion. So we'll put the motion on the screen, and Councillor Layton, if you could introduce your motion, please.
Yes, thank you very much, Madam Speaker.
Okay, Councillor Layton, if you can move, can you read your motion, please?
I'm sorry, I can't see the motion, so I hadn't opened up my
I see.
the portal yet, but I'm working on it. But this is in relation
Yeah, we
to
can get you this, so
a
that can
decision
run
of the
upstairs and
Heritage
get
Preservation Board
You
for
wanna-
property
you wanna
at
drop by in the
155
morning?
Cumberland.
Okay, thank you. All in favor? Carried. And members of council, I hear some voices, so if you can mute. Councillor Cressy, you have a member's motion you'd like to introduce?
I do, Speaker. I assume this is related to the bus lane designation on Queen West from the TTC.
Right. Okay.
So this motion is urgent in order to immediately support existing TTC operations with the temporary bus service on Queen West.
Okay, thank you. All in favor? Carried. So we'll go to our first item. Oh. Cool. All in favor of adopting the order paper? Show of hands. Carried. Thank you. So we'll go to our first timed item, which is HL 25.3. Okay, which is the Board of Health. Do we have any questions? If you can put your name on the screen. Councillor Thompson.
Thank you very much, Madam Speaker. I wanted to ask a question around recommendation 3B, which is requesting the Ontario government to provide necessary funding to support employers and so on to allow for no less than 10 days, 10 annual days in the event of the declared emergency of COVID-19. What my question is, Speaker, through you to staff, let's assume that a person is infected and they take 10 days to recover, and then there's a second infection from the disease. What is the option that's available for that worker? Is there another 10 days to permit them to be able to recover? Because it's just asking for 10 days annually.
So through the speaker, that may be a question that might be better addressed by my colleagues at TESS. I admit that, from our perspective as a public health, maneuver, providing sick days is really one that limits the opportunity for infection to spread. The operational side of how these things work, I admit, is a little outside of my purview. So if you don't mind, I would defer to my colleagues from TESS if they're available.
Not at all, Dr. Davila. Thank you.
Thank you, Dr. Davila, and thank you, Councillor Thompson. And through the speaker, it's an important question you're asking. The proposal that we have made through the Board of Health provides for that 10-day period in the case of a declared infectious disease emergency, because that seems to be a period of time that would be appropriate, as we've seen through COVID, certainly, in a normal circumstance if someone needs that extra time. If someone were reinfected and would need further protection, the proposal that we have put forward for council's consideration to pass on to the province and the government wouldn't provide that extra time, but perhaps in a regime where there were other benefits, perhaps provided through the federal government, residents in that situation after receiving the first 10 days through their employer could look for supports from another place.
Okay, thank you. And I guess this question would be for you, Dr. Davila. Recommendation 2B talks about expanding the system and so on, and looking at, rapid testing and perhaps home distribution of kits. And so I guess my question is, would that be the cost, would that be borne by the federal government in terms of expectation or the provincial government?
Through the speaker, generally when it comes to issues around testing, this is an area that's under provincial purview. Much like any other diagnostic testing that's done for any other health condition. And taking advantage of available technologies and increasing access through having different methods of testing, particularly in the case of a pandemic, is always helpful.
So on page 9, it talks about the voluntary isolation suites for families and so on, for support. How many of these suites are available, and do we have enough of them to meet demand, and what is the expected demand?
So through the speaker, it's hard to predict the demand in advance. However, what we have found is that it takes a variety of different forms to support people's isolation needs. Some people are able to simply, should they find themselves in a circumstance where they're diagnosed with COVID-19, have a significant exposure where they need to isolate from others. Some people can more readily move out of their own home and into a hotel-based facility. Others have different needs and may find that it's better, in fact, to have supports come into their home to help them effect, better isolation. And others, of course, may need supports for an entire family. So difficult to predict in advance who will need it. I think the real challenge for us, and what we have sought to do in partnership with all other city divisions working with us, is to provide a range of service options that meet the broad range of needs in order to effect good isolation, regardless of what the circumstances are.
Thank you. Thank you very much, Speaker.
Thank you. Councillor Carroll.
Thanks, Madam Speaker. Just a quick question. The board asked you, Medical Officer of Health, if you would begin posting regularly workplaces that have a defined outbreak. And I was wondering, I've never really paid close attention before. The board recommends it, and then that report is forwarded to council. But are you able to proceed with something like that just based on the board's direction? And are you planning on doing that?
So through the speaker, this is something that we have in the works and should be up and available as of next week, assuming that all goes well. We're just in the midst of transitioning to the provincial case and contact management information system. That is part and parcel of the system and infrastructure that we need in place in order to allow us to do this. We're anticipating that should be up by next week.
Okay. And so what I'm wondering is if in communicating with workplaces, and I would assume you'd start with large employers, is it also your intention to help us with stigmatizing at this point? I worry. I've witnessed this, and I've in fact personally experienced it within my own family. People stigmatizing people who have a positive diagnosis to the point where they don't want to tell that they've had a positive diagnosis, and so it's frustrating our efforts. So, will there be an effort made to say that, well, we need to post this to make sure that all workplaces will take all the necessary precautions? We want you to maintain an openness and a fair treatment of anyone who unfortunately tests positive.
So through the speaker, Councillor, you raised a very important point, and one that certainly, we're quite sympathetic to or patently aware of. This is, I think, one of those many issues, just one of many within the context of responding to this pandemic, where we are seeking to achieve that balance. Really trying to, ensure that we're creating an environment that allows people to come forward and understand where risks may exist and how they might mitigate risk for themselves, while at the same time trying to mitigate any opportunities for stigmatization. It is a very difficult balance to strike, one that we're working on. And of course, we're also being mindful as we post these things of important privacy considerations and maintaining confidentiality at the same time. But we are very conscious of that and are really trying to work hard with our community partners to reduce any stigma associated with being identified as somebody who unfortunately became infected with COVID-19.
Right. So is there any plan to add that to your daily media availability, that we don't, chastise someone who lets you know I've tested positive and you and I have been in contact? Don't chastise them, thank them for sharing, reward them for disclosing?
Yes, through the speaker, certainly happy to take that into consideration, not only for the media briefing, but how we might actually infuse that as part of our communications messaging overall.
Thank you.
Thank you. Councillor Wong Tam.
Thank you very much, Madam Speaker. My question is, with respect to workplace transmission, what evidence do we have that that is actually happening in the workplace?
So through the speaker, when we become notified of cases, particularly within the context of a workplace, there is an investigation that's done in order to understand whether there are opportunities for transmission or evidence of transmission within the workplace. So certainly when we get clusters of cases and then ultimately declare outbreaks within the context of a workplace, part of the investigation is to figure out whether the transmission might be arising from the workplace or whether in fact it's something from outside in the community.
Okay, thank you. My next question is probably to Tobias. What is the percentage or the number of workers that are covered by paid sick leave? Who's got coverage and who doesn't?
So through the speaker, thank you, Councillor. Nationally, approximately 42% of workers in Canada have access to some number of paid sick days. For lower paid workers, that number falls quite significantly down to closer to 10%, and that's the area of significant concern. The precise number of days that workers have covered in terms of paid sick days depends on a number of factors, including whether or not they work in a federally regulated industry, which province they are in, different collective agreements, etc. But those first two figures are the national figure, is the significant one. 42% have some coverage, but that number is significantly lower for lower paid workers.
And if we were to break down, well, sorry, there was a bit of feedback. If we were to break down that number of 90% of low-income workers who don't have coverage, is there a sense of whether or not they are racialized, they are women? What is the subset categories or populations that we could point to? Who are they, the faces, the individuals?
So through the speaker, as you're suggesting, in general, racialized individuals in Canada, women, newcomers would be more likely to be occupying lower paid professions and therefore have less access to paid sick day coverage at this time.
Thank you. In last year, the federal government introduced the Canada Recovery Sickness Benefits, or that's my son interrupting. And why is it that people who do fall ill, why is it that they cannot necessarily rely on that coverage?
So through the speaker, there are a couple of limitations to the Canada Recovery Sickness Benefit. There are concerns about awareness of this benefit in the first instance. There are concerns and limitations with respect to actually the application process for this benefit, the adequacy of the amount that it pays, and quite significantly, the timeline on which the payment is made. It can be several weeks. And so the challenge for someone who wakes up in the morning and is not feeling well and doesn't have paid sick leave through their employer, they may be concerned about needing to access this federal benefit and not knowing for certain that they would be able to be eligible for it because there are various eligibility criteria, and that is the concern.
And my question is, with respect to the number of sick days that are proposed in the report, that 10 might be the right quantum. There are organizations out there who have said perhaps 12 is the right number. At this point in time, are you comfortable with the recommendation of 10 paid sick day leaves?
To the speaker, we're comfortable with that 10-day period. We're looking for 2 full weeks, working weeks worth of paid sick leave. The requirement from the province right now for individuals who need to self-isolate because of infection due to COVID is a minimum of 10 days. So we felt that standard would be appropriate.
Okay, thank you very much.
Thank you.
Thank you. Councillor Ainsley?
Thank you, Madam Speaker. Through you, I'm not sure who to address this to, whether Dr. Davila, one of your staff. I was asking about clarification around masks. And there seems to be a discrepancy between, if you look at the World Health Organization and the provincial government and the municipality. I'm trying to understand where people would get the most accurate information about what they should be wearing for masks. And I understand, much like COVID, it is an ongoing process and we're learning more every day. But people talk about wearing double masks or masks with filters. For example, I'm trying to understand where I can direct my residents to get the most up-to-date information.
So through the speaker, Councillor, thank you for your question. You're quite right that, one of the challenges throughout the pandemic has been the evolving understanding. And that's not unexpected when we're dealing with a new virus. The short answer to the question is that the best place to go for information is indeed our website, toronto.ca/COVID-19. We are keeping information up to date there. And we follow the advice that's provided through the federal government and through provincial research bodies that are responsible for providing us with the best science on the subject. So that would be Public Health Ontario in our case. And I know that they work as well with colleagues at the Public Health Agency of Canada. Very briefly, the current advice that's provided, and this is outside of the context of occupational health settings or occupational health needs. So for the general public, they are still talking about 3-layered masks made of a tightly woven fabric, ideally with a filter layer in between. But I would refer people to our website in order to get the fulsome details on what makes the most sense. And of course, as the information changes, because it's constantly under review, we will continue to keep that information updated on our website.
Okay, and sorry, Dr. Davila, just to clarify, when you say to put a filter between the 2 layers of cloth masks, that's like the similar, I guess, layer they score.
Sorry, Councillor, I'm losing your audio. Madam Speaker, are you having the same audio difficulties?
Yes, I don't hear Counselor Ainslie. Counselor Ainslie, we can't hear you? Counselor Ainslie, if you can turn your camera off?
Can you hear me now?
Yes. Okay.
I can.
Can you hear me
Counselor.
now?
Yes, we can hear you now.
Madam Speaker, I'm sorry, are we still having audio difficulties?
Yes, I believe so. Counselor Ainslie, can you hear us? Okay, Counselor Ainslie, we'll hold your time down and we'll go to Counselor Bailão.
Thank you, Madam Speaker. Through
okay,
you,
Okay, just one moment. Counselor Bailão, go ahead.
okay, thank you. Through you, Madam Speaker. What's the role and responsibility of an employer when an employee gets in contact with somebody with COVID, goes for a test, tests negative, and is asked to come back to the workplace?
So through the speaker, I have to admit, I'm sorry, Counselor, occupational health and employment law is probably not my strong suit. I'm going to assume that, in the circumstance where you have an individual who might have been suspected of having an illness and is in fact found not to have that illness, I admit I would expect that there isn't necessarily a reason for that individual to not be at work. But I admit I am not an expert when it comes to obligations of employers or occupational health.
Okay. I just I'm constantly having challenges answering to constituents where they're in a conflict because sometimes they're being told by public health that even though they got a negative test, they should stay home for a few days, and the employer is telling them to come back to work, and it's really tough to advise on that.
So if I may, Madam Speaker, just in response to that question, and it will always vary from circumstance to circumstance. It depends on the nature of the exposure. So if there is specific advice from us as the local public health unit or whichever local public health unit is managing the circumstance, that there is a requirement and a need from a public health perspective for people to not attend work or to continue a period of quarantine or isolation, as the case may be, then I think that is the appropriate course of action. And certainly I know that in our case, if some kind of support is needed or confirmation, I know that we have occasionally been called upon to provide confirmatory letters, and if not, certainly healthcare providers, the individual's family physician can also be called upon to provide that level of support when and if needed.
Okay, great, thank you. Next question. So I noticed the report we're asking for the vaccine framework prioritization from the province, because I guess we don't know much at this point as well. At what point are we also going to start to reach out to the communities in our city to try to encourage vaccination? Like, are we preparing a campaign? Are we reaching out to different communities, community leaders, faith leaders? Like, is that the kind of campaign that we're thinking about?
So through the speaker, if I can answer very briefly, I think the answer to those two questions is yes and yes. We are absolutely reaching out and planning campaigns with various communities and various leaders within the communities, trusted social service agencies and trusted healthcare providers across the entire city, in order to ensure that people are aware of the options and what's available in terms of immunization, and really appreciate the value of immunization as part of the COVID-19 response and for their own self-protection and the protection of the community.
Okay, so we should start seeing that being rolled out within next fairly soon, few weeks, months?
Through the speaker, the work has already started, and I think you will start to see more and more of the communications type initiatives and efforts over the course of the next several weeks and months.
Okay. I noticed as well that you make a point of asking the provincial government for the funding that we continuously ask, almost every council meeting, the $48 million for our supportive housing. Can you explain the importance of having those support services, especially for that population, and why it's so important to have that funding, especially during a pandemic?
So through the speaker, very briefly, we know that there are certain actions that need to be taken, particularly distance and maintaining distance between people to the greatest extent possible in order to the spread of COVID-19. And the ability to do that, to maintain the appropriate measures to control the spread, vary from person to person. And some of the people, many people actually, in our community require additional supports in order for them to be able to do their part in terms of reducing the spread and transmission of COVID-19. So at a very high level, depending on the circumstances, sometimes that looks like assistance with isolation. Sometimes it looks like, sick days and income to support the ability for one to stay home while sick. And sometimes it looks like childcare or grocery supports. It all depends on the unique circumstances of the individual. But what they all come down to at the end of the day is how do we best support people to do the right thing in order to reduce transmission of COVID-19. It's good for that individual, and it's certainly good for the entire community around them. Hence, it's important to continue to ask for those kinds of supports as part of the overall effort to reduce the spread of COVID-19.
Thank you. That was your last question. Councillor Robinson.
Thank you very much. I wanted to ask some questions about Thorncliffe Park, which I represent. It is a hot spot in this city from what I understand. And I know January 17th, around that time period, there was a positivity rate of 22%. I think the week before that, 14%. Can you update me on how many active cases there are, and if we're trending up or down in Thorncliffe Park specifically?
So through the speaker, Councillor, I cannot give you the specific numbers for Thorncliffe Park at this point in time, but I can tell you that overall in the city, we have been over the last few weeks observing a decline in case rates overall and a decline in positivity rates as well. And this is largely attributable to what we are seeing in terms of people's ability to maintain distance. We are seeing reduced mobility overall in the city and increased distance and therefore reduced transmission. So this is all very good news. The one point I would add, though, is that given the emergence of variants of concern and the associated increased transmissibility that is associated with these variants of concern, now is not the time to relax. It is the time to continue to be vigilant around our control measures and around our individual distancing one from, in order to continue the good trend that we're seeing thus far.
Okay, and I had the honor of participating in a panel on Sunday with some very impressive individuals. Dr. Sharkawi and Dr. Shamji and Dr. Yu. And the reason we held this panel was to talk specifically to residents in Thorncliffe Park about vaccine hesitancy. My understanding is it's quite substantial that in that area, people are very hesitant about the vaccination. So this was a very powerful Sunday afternoon where these amazing, astounding, really, the depth of knowledge was phenomenal of these doctors. So what will the city do about that, specific to that area where there is such a high percentage of vaccination hesitancy?
So through the speaker, there is quite the undertaking being managed by us at Toronto Public Health in partnership with our colleagues at SDF&A, just to name one set of partners around community engagement and specifically addressing vaccine hesitancy. I'd be very happy to give you a more fulsome, sense as to what's happening. But suffice it to say that there is certainly a lot of communication materials that will be made available. And perhaps most importantly, it is around connecting with partners within communities, including Thorncliffe Park, who have established relationship with the residents there, trusted relationships with the residents there, and really leveraging those relationships to ensure that all the residents of the various communities around Toronto are provided with appropriate information and a good understanding as to what the value is behind COVID-19 immunization, to try to address that hesitancy and in fact turn it into what we would call vaccine confidence.
Well, I have to say this panel, I think, helped. Like over 100 people attended, so it was an excellent concept and very well attended and very, very helpful to everyone. I just want to kind of just play on Councillor Ansley's his questions. So my understanding is an N95 mask, which has a filter, is actually not good for people to wear because it makes it more dangerous for those who are not wearing it in the same area. Could you just clarify about filters again? Sorry, but it's important, I think, because certainly when I go into Sunnybrook, they do not want people coming in there wearing N95s because it's really puts other people at risk when you have that filter. So could you just provide more clarity?
Okay, that was your last question.
So through the speaker, a really detailed conversation on masks would require more time than we have right now. But I will say this, when it comes to N95s, these are particular masks that are generally used within for occupational health purposes, often in healthcare settings, but not exclusively to healthcare. And they have they're extremely good at protecting the wearer from, what they might be exposed to. It does require, if you want to get the full protection of those masks as the wearer of the mask, it does need fit testing. That has to be done through qualified and skilled and certified providers. However, for most of us, just a reminder, when it comes to masks, the greatest benefit around the mask is preventing our droplets, from going to others. That's the greatest benefit that we know with masks. That's not to say that there is no benefit to oneself, the mask wearer, in terms of protecting oneself from the droplets that others are wearing. But you can see how if we're all wearing our masks, we're all protecting each other from our own respective droplets. Add to that maintaining distance to the greatest extent possible, and we're now adding layers of protection. The current advice right now put forward by the Public Health Agency of Canada and confirmed by our colleagues at Public Health Ontario for the general public is to use non-medical masks, ideally 2 layers of a tightly woven natural fiber with a filter in between. But I would refer people to our website to look for the details on that and would be happy to discuss further offline if that's of interest to you, Councillor.
Thank you very much.
Thank you. Okay, we'll now go back to Councillor Ainsley. Councillor Ainsley, you have 2.5 minutes.
Sorry, can you hear me, Madam Speaker?
Yes.
Yeah, I've had Dr. Davila's clarified everything for me, so I'm fine at this point. I just like to thank her for all her work and also all the information her staff keep us updated on those different social media platforms.
Okay.
Thank you.
Thank you. Councillor Fillion.
Thank you. Hi, Dr. Davila. If you could, in case we run out of time, put me on the list to discuss masks offline as well.
Sure.
my first kind of area of questioning has to do with requiring people to have vaccines. And I know we're not there yet because not enough supply of vaccines. But when we get to the point where, for example, all frontline workers have had an opportunity to be vaccinated and some choose not to, what is our ability? This is, I guess, both a health question and a legal question. So I'll give an example of a frontline worker in one of our long-term care homes says, I don't believe in vaccines. I'm not going to get vaccinated. I understand that we can't force them to get vaccinated, but do we have the ability to say, if you're not going to get vaccinated, you can't be in contact with our people in our care?
So through the speaker, Councillor Fillion, you asked a very important and interesting question, one for which I don't know that there is a defined answer quite yet. I will say that at this point, the focus on the immunization campaign is that the immunizations and vaccines are being offered on a voluntary basis in the first instance, hoping that people will appreciate the value of the immunization for themselves and for the entire community. However, there are some precedents with other situations, notably within schools, that people may be removed from the environment, for example, if they do not have evidence of a particular vaccine and that or coverage against a particular disease, and there is circulating, for example, measles. Those individuals may be removed from that particular environment in order to reduce the risk. I suppose these are the kinds of things that have yet to be discussed, and of course, we're still trying to understand the longevity, the duration of the protection from the vaccines, as these are still relatively new, although they do seem to be quite effective in terms of stopping or preventing illness from COVID-19.
Can I ask anyone else on staff, perhaps legal, perhaps someone else, who is looking into that issue? And if you don't have an answer today, how we might get that answer? Do we as an employer have the ability to either not employ people because they refuse to be vaccinated or not employ them in certain roles?
Through you, Madam Speaker, this is a very good question, and it's a complicated area. As the Medical Officer of Health has indicated, the focus at this point in time is to educate and encourage. Certainly my staff are aware of the law in this area and are looking at it. However, whether something is a reasonable workplace standard is very dependent upon the context, including the workplace and the science. The science is evolving, and of course the city has many different workplaces. So this is an issue that we would look at in connection with the Medical Officer of Health and other city staff, if in fact we have a particular fact scenario presented to us where it's necessary to go a little further down that road.
Thank you. I may ask for a report through the Board of Health on that issue. Back to Dr. Davila, aerosols are, it's one of those issues where I think perhaps Canadian public health authorities have been a little bit slow to issue to provide advice to members of the public and on the potential danger of aerosols and how best to protect against transmission from aerosols. Can you tell me what the status of that is as far as advice that Toronto Public Health is giving people?
That was your last question.
Through the speaker, my understanding is that colleagues at the Public Health Agency of Canada are constantly reviewing the literature on this, as are our colleagues at Public Health Ontario. These are the colleagues who provide us with the greatest input in respect of scientific advice and the latest on the research out there. What we do know about COVID-19 is what is effective is basically boils down to distance, distance, and distance. Hence, you've heard us speak at length over the past several weeks now, especially around the need to maintain distance to the greatest extent possible, meaning limiting your interactions to the greatest extent possible to those with whom you live, not having close interactions with others unless it's absolutely necessary and absolutely essential. And even then, to ensure that you're wearing a mask and keeping the time to a minimum wherever possible. So what's interesting about this is that even in the context of variants of concern which show heightened transmissibility, the evidence to date shows that distance continues to be the most powerful tool that each of us has at our disposal against preventing the spread of COVID-19. So it is the one that we continue to promote because it is providing exactly the protection that each of us needs and frankly our community needs.
Thank you. Councillor Pasternak.
Thank you, Madam Speaker, and thank you, Dr. Davila. Now, in the package before us, one of the motions refers to reopen on
Councillor,
February the 10th, which oh, you can't hear me?
okay, we can hear you now.
Okay, I'll start again. So one of the motions before us is to have a plan. The promise to have a plan to proactively reopen schools and other sectors safely. Now, I understand the schools are going.
Okay, we can hear you now, Councillor
Back,
Pasternak. So if you could turn off your video.
Test.
Okay, go ahead.
Test. Mayday. You know. Okay, we'll try again. So one of the motions in front of us today in the package that's come from Toronto Public Health is to proactively plan to reopen schools and other sectors safely. Now, it's my understanding, correct me if I'm wrong, that schools are scheduled to reopen on February the 10th, which are probably, I think, is a good idea to get these kids back. Does Toronto Public Health have any authority or have any plans to extend that? Whether you have any statutory authority to extend that? Not that I'm asking for it, but is there anything in the offing that could extend that from the municipal point of view?
Through the speaker, so when it comes to issues around school openings and closures, if we're talking about individual schools and the need for closures, certainly that's been something, a power that we have exercised, although we've always done so in partnership with the school boards and with the schools themselves. We have seen other jurisdictions call for school closures, broad scale school closures in their own jurisdictions. We've been fortunate to not have to go to that, to this point. That being said, we have been in very active conversations with our provincial counterparts. It's our understanding that they will be making their intentions known shortly when it comes to schools, as obviously this is of interest to many, many people, not just here in Toronto, but all around the province.
Right. So can we assume there's no plans or authority by the Toronto Public Health to extend the school closure policy and can't do it on a system-wide basis, can only do it on a school-by-school basis?
So to date, that's through the speaker, to date, that's how we've affected our power. I never say never. I think that, the question is, what are the circumstances that we actually see in the community? how are they impacting schools writ large, and what makes the best sense given the information that we have at the time to control communicable diseases based on what evidence. So I don't think about it as a sweeping no or yes. It's a question of what are the circumstances and what makes the most sense in those circumstances from a public health point of view.
All right, thank you for that. Now we'll switch to federal jurisdiction. It's the airlines. Now, when people see these images on the television of people loaded up with suitcases, heading off to hotspots, on what unless they have a deficiency of vitamin D, I'm not sure why it's essential. But they estimate about 2% of travelers come back with positive COVID tests. Now that sounds like a small amount, but based on the numbers I have over the past year, that would have been 20,000 people with infections. Does the city have some kind of a policy? Now, the federal government's putting in restrictions now, but we're a year into this, and other countries are shutting down their airport resources, airport facilities. Does the city of Toronto have a position on how we can possibly contain the thousands of cases that come in via travel? Or do you dispute those numbers?
That was your last question.
So through the speaker, certainly this gives rise to concern for us, and we're not the only local jurisdiction that is concerned with the import of COVID-19 from other jurisdictions. This is firmly within the purview of the federal government, and certainly we speak directly to our federal counterparts. And as well, we provide our messaging through provincial counterparts who have more regular conversation with the federal level of government. And so we try to affect and influence change through those channels and otherwise really focus our efforts on those things that are well within our control at the local level to try to reduce spread here as best as possible. But certainly we have raised our concerns with the other levels of government and made clear what the impact is here at the local level so they can use that information to inform their decision making.
Thank you.
Okay, thank you very much.
Yes, I have a couple questions. Actually, one of my questions was that Councillor Pasternak asked about the federal government. As far as closing the borders and putting in strict restrictions at the airport. But I don't see anything, though, in the recommendations in our report. Why aren't we requesting the federal government to do this? I don't see any of the recommendations in the report, or is there somewhere in the report?
Through you, Madam Speaker, I believe we have made recommendations like that before and certainly continue to raise those issues with federal counterparts and as well with our provincial counterparts who often have different venues and tables where they can raise those concerns.
Yeah, but it's not in the report that we have before us now, so we've done that previously. So, okay. My next question is, I guess, to MLS. So it's my understanding in the last couple of weeks, there's been a number of notices and that were given and fines given to the big box stores. Is there any way that we can have a list of the businesses that have been charged? Can they not be made public?
So thank you for the question, and through you to the speaker. We, in the past, we have not named the businesses in so that they're not prejudiced before the courts as we move through the charges.
So we can't make the list of those businesses public. Okay, because that's one of the questions I get from my constituents, because it would be nice if we knew if it was a business in their community, then obviously they wouldn't be shopping at that particular business. Okay, that's it for my questions. Thank you. Councillor Holyday.
Thank you, Speaker. My question is concerning the recommendations about the Employment Standards Act and paid sick days. So I don't know if this is Dr. Davila or Mr. Novogrodsky that will take these, but can someone tell me why the recommendation was 5 paid sick days covered by employers?
So through the speaker, that recommendation is based on the current standard that we see in Canada as being the best standard for paid sick leave coverage, which would effectively be available to workers in federally regulated industries where they have 3 paid sick days after being with an employer for a certain period of time, and then have another 3 paid personal days. So in effect, it's 5 or 6 paid sick days. So that is part of the basis. What's the best standard for a class of workers in Canada? The second consideration is we looked at Statistics Canada data on the average number of days that workers are off due to illness or injury in Ontario. And that ranges over the past 5 years in the 6 to 8 day range. So we're looking for a period of time that would cover workers adequately. And that seems to be an appropriate standard from those 2 perspectives.
Any other provinces have that number?
The two provinces that have a number of paid sick days are Quebec and PEI, and respectively, I believe it's 2 days and 1 day at this time. So that's from a provincial mandated perspective. Employers, of course, on their own and through collective agreements often provide many additional days of paid sick leave.
So this covers all workers. So what happens if somebody works part-time? They work 2 or 3 hours a week, maybe in a store. You know, how does that work for the employer? How do they figure that out?
Through the speaker, that would be determined as of right now on an employer by employer basis. The standard in those provinces, we would need to look at more carefully whether that extends to part-time workers or to full-time workers. Often what we see is when those standards kick in different jurisdictions across Canada, it tends to be after either 3 months or 6 months of full-time or equivalent work experience with that particular employer when that standard would kick in.
Okay, and this really doesn't have anything to do with COVID. This is just an upgrade to the Employment Standards Act forever, is what you're proposing here. It's not, you know, while we're in a pandemic or anything like that. The recommendation is that council advocate to the government to change the Employer Standards Act for these type of sick days.
Through the speaker, that's correct.
And employers will pay those sick days, not the government. So the business owner will be required to pay that employee when they call in sick, for whatever reason. Nothing to do. It could be nothing to do with COVID. It could just be they're sick.
So through the speaker again, the proposal is for that first set of days, 5 days, to be covered by the employer. The thinking behind this is in effect what we already see evident in many agreements between employers and their employees through collective agreements, where the responsibility for the first set of days of paid sick leave falls to the employer. And then after that period of time, the cost of that sick leave in effect moves to the employee after a certain period of time. We believe 5 days is an appropriate standard. And what the recommendation in this report indicates is then during a declared infectious disease emergency, that's when additional support should be provided by orders of government, the province or the feds who have access to additional resources to enable those employers to provide the extra number of paid days.
My next question, so where did the 10 days come from in that particular recommendation? And to confirm, that is within the context of a pandemic. So that's a little different. So where did we find 10 days from?
So through the speaker, thank you for the question. That's the standard that we looked at based on our experience with an infectious disease like COVID, where it appears to be the case that 10 days or 2 full working weeks of leave is the period of time that someone who has COVID in this case, or an infectious disease that might be similar to it, would need to be able to self-isolate.
Okay, and last question.
That was your last question.
Your report talks about the gap, if I may finish, Madam Speaker, the report talks about the gap in the Canadian benefit provided to employees when they're sick and they're not able to go to work. And you talked about the gap in getting the money quickly and the amount and the qualifications and so on. Why not just simply recommend to the government that they fill the gap during COVID?
So through the speaker, certainly there could be recommendations that could be made to the federal government to improve the existing Canada Recovery Sickness Benefit in terms of its administration or its adequacy or how quickly it gets processed. At the end of the day, one of the concerns, though, about a federally provided sick benefit is that it's not provided by the employer, and at the end of the day, many precariously employed individuals may feel that they need that normalized employer-provided benefit to maintain their good standing with their employer, as opposed to trying to collect a federal benefit after the fact, and there could still be potentially repercussions in their own workplace.
Thank you. Councillor Cressy.
Thank you, Speaker. Just a few brief questions for both Dr. Davila and Mr. Novigrowski. Dr. Davila, Toronto Public Health collects disaggregated data based on income. What percentage of Toronto's cases are people living on lower incomes?
Councillor Cressy, I apologize. I don't have the number directly in front of me, but we certainly know that it's a disproportionate impact that is experienced by those who are living on lower incomes in our city.
All right, let me rephrase. Is it your understanding that 49% of Toronto's cases are people living on lower incomes?
So through the speaker, that does sound correct, Mr. Cressy.
Okay, so about half. To Mr. Novigrowski, what percentage of people on lower incomes are estimated to have access to paid sick leave?
Through the speaker, we're looking at in the order of 10%, maybe a bit higher depending on industry.
Okay, so we've identified about half of our cases are people on lower incomes, and we estimate that about 1/10 of people on lower incomes have access to paid sick leave. Dr. Davila, does Toronto Public Health continue to see workplace outbreaks in our city currently?
The speaker, yes.
Okay, and over the course of this pandemic, has Toronto Public Health seen evidence of workplace outbreaks where people are working while sick?
Through the speaker, yes, we do.
Okay, and in your investigations of workplace outbreaks, has Toronto Public Health seen evidence of places where workers work while sick and where they don't have paid sick leave?
Through the speaker, yes, we see that as well, unfortunately.
Okay, so based on the percentage of low-income workers in our city, the percentage of them that do not have access to sick leave, the current workplace outbreaks, and your investigations into this, is it your opinion, doctor, that emergency paid sick leave is necessary right now to stop transmission of this virus?
Through the speaker, simply put, yes.
Okay, thank you. Those are all my questions.
Okay, thank you. Councillor Perruzza.
Thank you, Speaker. I just a couple of questions. I'm not understanding this whole vaccine business. So what is the problem? Why aren't we getting, sort of our fair share of vaccine in the city of Toronto?
So through the speaker, the issue around vaccine supply that's being experienced is really a question that's best directed towards the federal level of government. It is within the responsibility of the federal level of government to procure vaccine that is then subsequently distributed to the provinces, who in turn ensure the administration and delivery of those vaccines, and that's generally done at the local level.
But in terms of your understanding as a public health unit, and I'm sure that you have these conversations with both our provincial partners and our federal partners all the time, what's the problem? Is it just Pfizer and Moderna can't produce enough vaccine, or is it because other countries kind of supersede us in terms of their ability to get it from those companies?
So through the speaker, certainly what I have heard through the conversations I've had are that there's no question there are huge demands being placed on various vaccine manufacturers. And in our case, the two that have been approved thus far for use in Canada are, as you rightfully point out, Councillor, the Pfizer vaccine and the Moderna product as well. So those two products are under extreme demand from across the globe. And so I believe that manufacturing challenges continue to be one of the reasons behind supply issues. With respect to how we fit into the global purchasing pecking order, I don't know that I have very much to offer in that regard, but I imagine that that might be something that our federal counterparts would be able to speak to with great detail.
Now, I haven't been able to really understand this, and I was having this conversation a little earlier with my colleague, Councillor Cole. In terms of manufacturing, so we have local producers of medications, people like Apotex and Sanofi Pasteur and others, a myriad of others. So these people aren't capable or don't have the technical ability to produce like a Pfizer or Moderna vaccine.
So through the speaker, I can't speak specifically to what the capacities of an Apotex or a Sanofi here might be around making vaccines. What I can talk about, though, is that making vaccines is it's a complicated business. I don't think it's beyond our capacity in Canada. It's not that we don't have the skill sets or the possibility or potential to do so, but it is. It does take a great deal of capital investment, and it is one that needs to be approached, with a great deal of thought, because it is difficult. You have to think about we're providing a therapeutic intervention that is preventive. So the standards are quite high when it comes to vaccine production, and they're appropriately so.
Okay, but here, so let me understand this in a simple way. So Pfizer has a formula. No one else other than Pfizer can produce the Pfizer formula of vaccine, or is it a proprietary thing? Is it because Pfizer invented it, so it's their corporate, it's their corporate right to sell their vaccine in the production capacity that they're able to produce it at to countries that they choose to give it to. Given that it's a global pandemic, why aren't countries asking Pfizer, for example, to share their formula more widely with other producers so we can ramp up production and get it out there and pay Pfizer for their, for whatever they're owed for that, for the patent or for the invention, as it were, of the vaccine.
Okay, that's your last question.
I'm probably not the best person to answer the question in regards to, who has the right to make what vaccine and how those processes are undertaken. I would say this though, the type of vaccine, this mRNA vaccine, that is the type of vaccine that's being made by Pfizer and by Moderna, is a relatively new in the world of vaccine technology, if we can call it that, and presumably requires a specific kind of manufacturing facilities, which have not existed to date anywhere. Again, these are relatively new technologies. So I imagine that may be part of the reason why we're not seeing, factories or the vaccine being made in many, many different places, presumably because there is some capital investment and some significant infrastructure that's required in order to actually produce these vaccines. But this is not my area of expertise, so I'm offering you the best answer I can with my existing knowledge.
Thank you.
Thank you so much.
Thank you, and that's it for the questioners. We'll go to speakers after the break. Members, because we lost some time this morning to our technical problems, it has been suggested that we reduce our lunch break to 30 minutes. I'm therefore proposing the following, that we recess it now until 1 p.m. And when we return, we complete the debate on the two public health items before proceeding to members' motions. All in favor?
I'm opposed to that, Madam Speaker.
Okay, so you want a recorded vote?
Well,
Why don't we
you know,
keep
if I
going
can
until
explain-
1 o'clock?
No,
I'm
because,
I'm in a workplace, so I got to go out and get food. I mean, it's pretty tough to arrange all that. in 30
well, the
minutes.
problem is that we lost a lot of time this morning and we want to get this item completed. So we're recommending a half-hour break for lunch.
I'll vote on that.
Okay,
Well, I'm opposed to that.
on
So
favor?
I'm opposed as well.
Let's take a
Well,
vote.
Speaker, why don't we make it an hour lunch and then come back at 1?
Record a vote.
Okay, let's take a vote. We're just wasting time now.
Amend that, Anthony.
Okay, we're just
Anthony,
wasting
amend the
time.
motion.
Let's take a recorded vote.
Councillor Mallow, it appears to us you haven't received the vote. Can you tell us how you're voting, please? Councillor Mallow, it appears to us you haven't received the vote. Could you state your vote, please? Councillor Grimes and Councillor Carroll, same thing. It appears to us you have not received the vote. So if you
I
can
did
state your
not
vote.
receive the vote. I vote in the affirmative.
Councillor Grimes.
Grimes in the affirmative.
And Councillor
In the
Matlow,
affirmative.
please.
I'm in favor.
Councillor Pasternak, your vote, please.
You know what, my audio went out. Was this to extend?
This is to shorten the lunch hour to 1 p.m.
Yes, in favor. That was close. I knew it was regarding lunch.
Speaker, the motion to amend the order paper carries. The vote is 18-6.
Okay, thank you.
Speaker, could you just run over again exactly what will happen? It's 1 o'clock. We will come back to this item. Is that what you had said
Yes,
earlier?
that is my recommendation. At 1 o'clock, we have a 30-minute lunch, and when we come back, we'll finish this item, and then we'll go into the members' motions.
Thank you.
Yeah, and we have two members' motion that we want to introduce. We have 1 minute.
Speaker, I'm very sorry. On a point of order, it's Councillor Cressy. You had indicated previously that we would come back after lunch to complete this item and the other public item
Yes,
immediately following
yes.
before members' motion.
Yes, yes.
Okay. So it's two items. Okay.
I'm sorry, which two?
Okay, the two public health items, HL 25.3 and 25.5. We're going to finish those after lunch, and then we'll go into members' motions.
Thank you.
Councillor Cressy, you have a motion that you want to introduce.
Sorry, Speaker, I do. This motion is urgent in order to permit the required capital repairs to be undertaken without further delay with respect to a local co-op in our city.
Okay, on favor? Carried. Okay, we'll recess to 1 o'clock. Thank you.
help or those that are uninsurable for flooding for whatever reason in their area. I have a similar circumstance in parts of John Valley North.
Okay, being that that's my motion at committee, I believe that that's a friendly amendment.
Thank you.
So on the amendment by Councillor Carroll, on favor, show of hands, carried. Item as amended, on favor, carried. Thank you. Councillor Wong Tam.
Thank you very much, Madam Speaker. TE 21.9, 202 Jarvis Street and 160 to 166 Dundas Street East. Official plan amendment and zoning amendment application, final report. I'd like to move a motion to defer this matter till March 2021, our next council meeting.
Okay, so on T 21.9, Councillor Wong Tam is deferring to March. On favor, show of hands, carried. Are there any further quick releases? Okay, thank you. We'll now go to the speakers list on HL 25.3. Yeah. Okay, Mayor Tory to speak.
Thank you, Speaker. I have two motions, which we can put up on the screen, and I'll speak to both of them. The first has to do with providing for the payment to some of the partner agencies. They're going to help us with our community engagement and mobilization on the vaccination program to allow them to go ahead and make these expenditures and these agreements with community agencies pending receipt of this money back from the province. But we need to move forward. And the second is the mechanics, I'll call it, of the extension of the different bylaws recommended by the Medical Officer of Health that we had put in place, and extending them for a period of time until June, subject to some reviews that are provided for as well. So those are the two motions that are in front of you. And if I might speak to them, first of all, I want to begin by saying there's been thanks on a general basis and many other different kinds of thanks expressed, but I'll do it again just because it's worth doing in the circumstances, to thank our public health team, led by Dr. DeVilla, but all the people I'm familiar myself because of the daily exposure I have to all the incredible work they're doing on a whole host of fronts, and they've done work that's done us proud, and I just want to say thank you for that. I want to, though, add to that the work that has been done by the agency, some of the ones that are going to be covered by this very one of the programs that's provided for in this report from the Board of Health, I'll also and then also the professionals. We've got, as we talked about this morning with the media, in the case of the programs to help the Black community with some of the disproportionate impact that the pandemic has had on them, and the disproportionate job we have to do getting them around vaccine hesitancy. Some of the very best professional people helping us, including scientists in the Black community who formed up a table that is really helping us with those efforts, including public education and virtual town hall meetings and so forth. So I want to say thank you to them as well. I'm very proud of the fact that, while you never achieve perfection on these things, that the city itself has done what I'll call real pioneering work. We've shown real leadership, I think, among cities in North America in trying to address some of the needs of our most vulnerable populations. And I think in a number of instances, and some of them are not yet resolved, I'll be honest about that, we have done so as a city and just said, and I certainly have said when I've been asked, I think the budget chief has said, the chief financial officer said, the city manager has said, that we're going to move forward and do these things because they're the right thing to do, even in instances where we haven't yet confirmed money that should be forthcoming from the province of Ontario to do these things. These are basic tenets of our public health assignment that we have as a city under the auspices of our Board of Health, but also under the auspices of the city government as a whole, that they properly fall onto the list of things that this city, unique as it is in all of Ontario, big as it is in all of Canada, must do, given that all of the particular problems we face of disproportionate impact on some of our citizens are going to be bigger by definition than anywhere else in the country. And so I want to say thank you again to the staff and the partners. The fact is that all of the good we've been able to do has not been done by the government itself, but has been done in almost every case without exception in partnership with community agencies who not only know what they're doing, but I think just as importantly in the case of many of the groups they're trying to serve and support, they are trusted, by those groups. So if you're going to get around vaccine hesitancy, for example, then you're going to have people who are trusted to carry out that very delicate task. And so the motion A here provides for us to move forward to engage in agreements with these partners on the community engagement and mobilization component of the immunization program. So I'm told in conversation this morning that this is a relatively modest amount of money, that we're taking a chance, yes, that while I would argue strenuously this will be submitted as a part of our core public health responsibilities we had to carry out, just like everything else we're doing to do with immunization that will be funded by the province. There's some chance they may distinguish. I don't know why they would between that and this assignment, but they share our view that they want all 3 million people in Toronto to get immunized. So that's the first part. The second part is to make sure that we that we extend bylaws that I think we all agree still need to be extended for a period of time. And I think June is as fair a period of time as any other, but we have said we'll review these things every month. But we're now to the stage with respect in particular to the community engagement strategy on the immunization task in front of us, where we have to engage the community. The worst thing we could do is leave it until the minute when supply is available and when our clinics all do open. And there's been tremendous good work done by Chief Pegg and the immunization task force that we set up before there even was a vaccine as a city. And I think the results show for that, which is that we're when I say we're ready, we are going to be ready. So I just think this is an important thing to allow our excellent public service staff, who are, I find, very accountable to me, to the chair of the Board of Health, and to the city manager and others, so that I think this is a small risk, but a risk worth taking in order to allow us to get on with a very important task that has to be done to engage the community in this very important next stage of wiping out this virus, which is the immunization phase. So those are my comments, Speaker, and I thank you for the time.
Thank you. Councillor Cressy to speak.
Well, thank you, Speaker. At the moment, our staff in the city are responding to COVID while also dealing with variants of concern that have arisen. They're planning one of the largest mass immunization campaigns in our country's history. They're preparing for recovery, all the while continuing to do all the other work that a functioning city requires. Our city staff are doing all of those things at once. It is back-breaking tough work, and I think we owe them all a deep set of thanks. And I know we do this every month, but we're in the midst of an emergency unlike any we've ever seen. So to our medical officer of health and her team, to the city manager and our DCMs, to Chief Pegg and the entire immunization task force group and the EOC, and to Mayor Tory and his staff. I've never been prouder, and admittedly more tired, but I've never been prouder of being a member of this city and the city team than right now. The situation right now, more than a year after our first discovered case of COVID, is such that we are turning the corner on the second wave. We truly are. That curve bent finally on the second wave, not without huge sacrifice and huge hard work. And I say this understanding the angst that it causes and the uncertainty, but if we do not continue forth with our resolve and enhanced steps with more transmissible variants, we could see a third wave. That is not hyperbole. In fact, it's just math and science. And so it's in that context that we, as a council today, are considering a series of additional actions and recommendations in front of us. And I urge you to support each and every one of them, including the important two that the mayor just moved. There was a time early in this pandemic when we were still learning about this new virus, where the discourse was about learning to live with COVID. But over time, here's what we've learned. Here's what every jurisdiction around the world has learned. The only way you beat this virus is by targeting zero cases and putting in place the measures to support case counts as close to zero as possible. You don't just have to look at New Zealand and Australia and somehow say Canada's different. Just look at Atlantic Canada. So how do you beat COVID? In addition to rolling out an immunization campaign, restrictions to limit contacts, protections to support frontline essential workers, strong measures to tackle travel with travel restrictions, enhanced and improved test, trace, and isolate systems, and measures to mitigate the harm associated with all of the above. There's no silver bullet. It requires all of those things. But here's the painful reality, and it speaks to one of the recommendations today, is as a country, as a province, we keep trying to do some of those measures, in particular the restrictions, while ignoring the other side of the coin, which is the enhanced supports for those who must continue to go to work. And the results show. The data is the following. 50% of the cases in our city are people on lower incomes. Meanwhile, only 10% of people on lower incomes we expect to have access to paid sick leave. 60% of our frontline, of our workplace outbreaks are in frontline essential settings. And TPH has evidence and has documented that people are working in those settings while sick, and they don't have sick leave. So low-income workers, those heroes that we talk of, who are stocking our shelves, delivering our goods, processing our food, those heroes who are keeping our seniors safe, they're the ones at risk. They're the ones who are tragically continuing to get sick and in turn transmitting the virus. And that's why there is a call here in front of us today for 10 days of sick leave during this emergency pandemic, subsidized by government so that employers are not bearing the cost. That's not a partisan ask. It's not a political ask. It's just good health advice. And with more transmissible variants already here, already circulating within the community, it's more important than ever. And so while hope is on the horizon, the largest immunization campaign in our city's history is coming when supply arrives, with clinics and mobile clinics and targeted efforts.
5 seconds.
To all underserved communities. Now is the time to scale up our response. Thank you.
Thank you. Councillor Mantis?
Thank you, Madam Speaker. As Mayor Tory and all the and everyone that spoke earlier about this recommendation, we live in a city that is multi-ethnic, multi-faith, multicultural.
Councillor, sorry to interrupt, but do you have a motion? You need to present it before you speak.
Yes, Madam Speaker. The motion that I would like to put up to enhance the recommendation that we have in front of us, as we live in a city that is multicultural and multi-ethnic, we need to assist everyone in the immunization program to be able to have everyone understand and being able to read in their respective languages the immunization effort that we have in front of us. So I would like to put this motion on the screen.
Okay, thank you. Councillor, did you want to speak?
I think I just did.
Oh, okay. You have 5 minutes. That's okay. Thank you.
And a fine speech.
Thank you. That's great.
Thank you.
Thank you.
Thank you, everyone.
Councillor Thompson to speak?
Sorry, Madam Speaker. Sorry, on a point of order, it's Councillor Ainsley.
Yes.
I've received a couple of messages that on the live feed to the public that there's no sound.
Okay, thank you.
Thank you.
Councillor Thompson to speak.
Thank you, Speaker. Do you want to start my time over?
Yes, I'm going to add it on to your time. Thank you.
Okay, that's fine. Thank you very much. I believe I have a motion, and hoping staff do have it. Yes, they do. Okay, so my motion, Speaker, is that City Council requests the Government of Ontario to require that employers provide paid sick leaves due to an infectious disease posing significant risk to the public, to workers for the duration of prescribed by a medical professional in the event of a declared infectious disease emergency, such as COVID-19 pandemic, when there's no option for the workers to perform work at home. Speaker, I too want to offer my thanks to the Medical Officer of Health, Councillor Cressy, the leadership of the Mayor, and everyone that's been working, has been described for almost a year now on this pandemic. We know that there is a tremendous amount of disparity with respect to people who are getting the disease or contracting the disease. And we heard from the mayor this morning, Councillor Cressy and myself, at the press conference regarding the work that the city is actually doing on behalf of the city in collaboration with community agencies. And I also want to loud out the amazing team led by Denise Campbell at SDFA and the work that they're doing. I can't tell you, Speaker and members of council, how proud I am of the amazing work that the amazing team are actually doing. But with respect to my motion, and we've heard from the Medical Officer of Health and during her questioning this morning answered, particularly questioning from Councillor Holyday when he said, look, are you suggesting that the payments be continuous for duration beyond a period where we're dealing with a pandemic? My motion is simply suggesting that we do more to help, because in some instances, 10 days is not sufficient for those employees who are not able to work at home. I have, Speaker, spoken to a number of people who have actually got the virus, and in fact, it's taken them a tremendous amount of time to recover. And in some instances, the question is, how are they recovering? Because as we've heard from the Medical Officer of Health, this virus operates and deal with people in different ways and so on. And so I'm asking that we obviously request the provincial government to look at broadening its scope in terms of helping through its mechanism to require employers to be able to help those workers who are not able to perform their duties from the comfort of their home and so on, while they are suffering through the challenges of the virus. And so I hope that members will support the motion. Thank you, Speaker.
Thank you. We do have some questions for you. Councillor Holyday, clarification of the motion,
Speaker.
3 minutes.
Thank you, Madam Speaker. Through you to the Deputy Mayor. I want to make sure I understand the intent.
Yeah.
In what I read, it's asking the government to require employers to cover the cost of the paid sick leave. And, for example, if I'm a small general contractor or a roofer and I've got a couple of people employed and one of them becomes a long hauler and is sick for a couple of months, is the expectation that the employer is going to pay them to be at home for 2 months?
Well, thank you very
How
much
could
for
we
the
make that
question,
work?
Councillor. And sorry, were you finished?
Go ahead.
Thank you. Look, I'm asking the provincial government to look at the opportunities in terms of how we can get employers to actually help those who are suffering and those who are sick. Because clearly, in this particular case that you've described, Councillor, if that is the case, you'll probably find that that worker will more likely try to continue working, because if they don't work, they can't feed their families. And in doing so, then we put more people at risk. And so we're looking at ways and means to mitigate and minimize the opportunity in terms of the spread. And so there are things that they may have to do, and I don't know what all those things are, but what I do know is that we actually have to do something based on the information that's been communicated both by the Medical Officer of Health and just widely held as a rule, because if people cannot obviously provide for their support for their families and so on, they will actually go to work sick, and I think that it puts the community at greater risk.
Thank you.
You're welcome.
Thank you. Councillor Cressy, 3 minutes, clarification of the motion.
Thank you. To the deputy, so in reading your motion, am I clear that the request is that employers, not the government, would be financially responsible for providing this sick leave during an infectious disease emergency? Do I understand that correctly?
That is the intent.
So So first of all, do you recognize that that is in conflict with the staff recommendation, which is that governments, not employers, would provide the funding so as to protect the financial viability of employers?
Yeah, no, I get that, Councillor. And what I was thinking about with respect to putting the motion together is that thinking that employers will create opportunities where they can provide insurance to employees. And I think certainly this will be, there's a requirement to sort of dig into it a little bit further. But I do think that there's an opportunity for employers to provide insurance as an option for their employees. And so this would be the mechanism in which I would hope that employers will be able to afford to provide this benefit to their employees.
So can I ask, if your intent is to encourage employers to provide assistance,
sure,
but rather not to be in conflict with the staff recommendation, which requires governments to pay for it, would you be amenable to a friendly amendment that said, request the government of Ontario to encourage employers as opposed to require, so that it's not in conflict?
Yeah, no, absolutely. That's fine, because really at the end of the day, the intent is to ensure that there's opportunity for employers to work with their employees, because they're a valuable resource, and to ensure that they can help them in order to help us as a society, reducing the risk and so on. And at the same time, ensuring that those individuals, which we've learned from the discussions that we've had in terms of response to questions today, who are people who are working in jobs that certainly need to be performed, but they are not well paid and they don't have the benefits that many enjoy, quite frankly. And these are people that are marginalized for the most part. But I'm fine with that, Councillor Cressy. I think that works well.
So, okay, and so then, Deputy, if it's all right, I'll take this offline with you, and perhaps
sure,
with the intent of, as I understand it, what you're envisioning, perhaps we could work on that language. And thank you. This is very helpful clarity.
No worries. Thank you very much.
Thank you. Councillor Pasternak, 3 minutes, clarification of the motion.
Oh, thank you very much. I doubt I will need 3 minutes. Through you to Deputy Mayor Thompson, just very quickly, I've read your motion a few times, and I know there's a debate, and now vacation travelers and what have you who come back.
I didn't hear you after the word debate, Councillor.
Oh, let me turn. I'm going to turn my video off.
Sure, that's fine.
So I've read the motion a couple of times, and I'm trying to figure out. There's debate now on whether people returning from travel, foreign travel or domestic travel, have to quarantine. Well, they do have to quarantine, but if they have to quarantine, are they eligible? Are you advocating for sick leave benefits during that 2-week quarantine? I'm not quite sure.
I'm not. I'm not actually. I'm not seeking to provide a reward for those who are taking on the burden upon themselves to travel and then to expose other Canadians and so on. No, I'm simply talking about workers who are following the rules and are attending and going to work and maybe and are get the virus and so on. And 10 days is not sufficient for them, and they would have to obviously have a medical note saying that as a result of the pandemic, they are obviously sick, and this would support this idea of them being able to be supported. No, I'm actually not seeking to provide a benefit to those people who have taken it upon themselves to travel and then come back and then would be rewarded. No.
Yeah. Do you think we should amend it, or do you think your wording's? I'll go on your advisement whether you think we should word excluding. I don't know whether we would call them out of country travelers or international travelers.
Sure, and thank you for that. But I think that, and I don't know the clarity of it just yet. Maybe I may want to take a look at it. I know the federal government was actually responding to that over the last number of weeks. It was my understanding that they had actually put in mechanism to ensure that those individuals were not being rewarded, and I would think that we would be covered under that, quite frankly, assuming that in terms of the provincial government looking at this, we would want to make sure that those individuals would not be rewarded. So my motion really is not intended on providing a benefit to those individuals, because that would be a benefit to them. What I'm trying to do is try to help those who are vulnerable individuals who would otherwise have to work, even though they're sick, and thereby obviously spreading the virus further. And we, as Councillor Cressy has indicated, is that we want to go to zero, as close to zero as possible, if not to zero.
Thank
Okay.
you. That was
All
your
right.
last,
Thanks
that was
very
your
much.
last question. Thank you. Councillor Perks, 3 minutes, clarification of the motion.
Thank you very much, Speaker. Councillor Thompson, I think I know what you're trying to do here, but we have to take such care with our words.
Yes, okay.
When advising policies like this. The part I'm not quite understanding is the clause that says to workers for a duration prescribed by a medical professional.
Right.
And I think your intention there was that if a medical professional said longer than 10 days, then they're protected. But I'm just worried that if someone, the advice we give now is if you're experiencing certain symptoms, you don't have to first go to a doctor to ask for those sick days. And I just want to make sure I got you there.
Right. So, yes, you're absolutely right. So, I mean, the first 10 days, you go through that particular period where you are quarantining and isolating yourself and so on. And of course, if after those 10 days, you're fine, you go back to work. What I'm actually alluding to, Councillor Perks, and really thank you very much for asking, because this helps to broaden the scope of providing the information. What I'm alluding to is that beyond that, you're still
Right.
sick. And to the degree that you're not working, and I'll tell you why this came about. This came about of speaking to a young couple who had in fact gotten the virus, and they are well beyond the extended 10 days.
Councillor,
And
I so- only have 3 minutes and I have a follow-up.
Sorry.
Oh, no, that's fine.
And I'm just
wanna,
trying to design
I know
a
that
way
you
to be able
undertook with
to help.
Councillor Cressy. I know that you undertook with Councillor Cressy to maybe polish this up
Yes.
a bit. Could I just hope that the way that you're dealing with Councillor Cressy makes it clear that this is for additional days, not just for those, not for those first 10?
That's correct. Yeah.
Okay.
That is the intent.
If that's what, if you can tidy that up,
That is the
then I'll understand better. Thank you.
Okay, fantastic. Thank you, Councillor Perks.
Thank you. Okay, thank you. Councillor Wong Tam to speak.
Thank you very much, Madam Speaker, and I'd like to just rise to say and extend my thanks, honestly, to the members of the Toronto Public Health Service. They've been working steadfast and nonstop since the beginning of the pandemic. Their hours have been long. As Councillor Cressy, our chair, has noted, it's very difficult work. And of course, all that is happening under the leadership of Dr. Davila and her leadership team. But again, I want to extend my personal thanks, and I think we all should, to Councillor Cressy as well as Mayor Tory. They have been working nonstop. They have been steadfast in their leadership, and I know for them that means a lot of personal sacrifices, especially for Councillor Cressy, who has a young child at home and doing everything he can to make sure that he maintains the life of balance between work and family obligations. And I just didn't want it to be unnoticed that it's been a year now, of course, since the pandemic, but everyone has been giving it their absolute all. And I've never seen a Board of Health chair work as hard as Councillor Cressy, and I want him to know that we certainly appreciate him at the Board of Health. The issue around the pandemic, I just want to acknowledge that, we have all been extremely privileged, and I think all of us who are sitting in our homes and on our tablets and devices, we are the privileged. We have the opportunity and, of course, the luxury to stay home, and while we do that, we stay safe. And there's a whole number of people who do not. And one of the items that has been of much discussion so far today is around the paid sick leave. And I know that it's not necessarily something that council or municipalities have direct control over, but I do recognize that we have identified this as an issue. We have repeatedly raised this with the provincial government, and clearly we are a year out, and we still don't have the paid sick day leave that is required, so that if someone is infected, they need to stay home and not be worried about whether or not they can put food on the table for their families, or still maintain their rents or pay their mortgage so that they can stay housed. It is an absolute shame that we have to raise this matter once again. And I think that Deputy Mayor Thompson's motion, he's doing everything he can to ensure that if the province of Ontario doesn't step in, then he as the chair of economic development and culture is asking businesses to step in. I mean, that's how desperate the situation with respect to paid sick days is. And it has become at this particular point in time. So, I know that I know that that's not a decision that necessarily that he would make lightly, especially because he's such a champion for entrepreneurship and businesses. But at the same time, if we don't have the support from the provincial government, we're left with very few other choices. So I want to thank Councillor Thompson for raising that particular motion, because I know that it took a lot for him to consider how would he approach that, and to do it with such a delicate balance to make sure that we can all chip in, every single one of us, regardless of where we are and how we sit. And then finally, Madam Speaker, just to reiterate the point, because I think it needs to be said, and we can never lose focus on this piece, is that 58% of Canadians have no access to paid sick leave. That is not my number. That is the number that came from our city staff. And that 90% of low-income workers have no coverage when it comes to them becoming ill and being able to stay home and stay safe. Those numbers are just mind-blowing when you think about, as we try to do everything else we can with all the different tools before us to try to curb the pandemic and the community spread. So this particular piece, when it comes to paid sick days and the requirement of some days from the provincial government, is probably one of the most important tools that we need, but we don't have access to, and we need desperately for the provincial government to step in and actually fill this critical gap. Otherwise, we will not be getting further ahead, regardless of how successful the mass immunization program is. We need this, and hopefully the provincial government is listening today. Thank you very much, Madam Speaker.
Thank you. Councillor Fillion to speak.
Thank you very much. Just want to start out by saying, how fortunate we are to have such tremendous leadership in Dr. Davila and the Mayor and Councillor Cressy, Chief Pegg, and many others. Really, it's remarkable how strong Toronto's leadership is on this issue. I don't have any motions. I strongly support what the Mayor and Councillor Cressy have moved. There's one area, and I don't intend this to be a criticism, because I think everyone has done public health has done a remarkable job, but I think there's kind of a gap between what information that the public is looking for and wants to be able to find readily, people who are trying not to spread the virus or try to keep themselves and others safe and are a little bit lost with some of the information. And in Canada, we have a decision-making, health hierarchy, which is extremely cautious and sometimes slow to move. And on health issues, that is, almost always a very good thing. But on some areas of advice, it has not been. And the obvious one being in the area of masks, where at first we were telling people not to wear masks, and of course information understanding has evolved, but we're still kind of slow on that to tell people what they need to know. Likewise with aerosols, in other countries it was recognized long before Canada recognized that the virus could be transmitted through aerosols. So when you combine the issue of the higher risk of the new variants that we're not entirely sure, we know they're more transmissible, we're not entirely sure what that means in terms of people protecting themselves. And sure, we can continue to say, well, stay 6 feet away and wear a mask. But I think people are looking for, a bit more information. So, for example, when you can't stay 6 feet away from where aerosols may have been transmitted, I'm just making up this example, but a high-rise elevator that people just got off of, maybe somebody wasn't wearing a mask, and then you get on, and there's still aerosols hanging in the air, and you're right in the, the middle of that cloud potentially. What are all the things you can do to protect yourself? And I understand us saying, well, we think, you wear 2 layers of mask with a filter, you should be fine. But, I think, again, people want a little bit more detail on that. And if if wearing 2 masks is better than wearing 1 mask sometimes, then, why not do it unless there's some reason why that's a bad idea. Like, providing yourself with more protection should always be a good idea. So unless it's the case with N95s that Councillor Robinson was talking about earlier, and I didn't know that information, that was helpful to hear. I just think we need real clarity on a lot of these points so that people can, be as safe as they want to be. Thank you.
Thank you. Councillor Holiday to speak.
Thank you, Speaker. I have 2 motions. May I ask the clerk to present the first one? So the first one is an amendment to item 2A, adding the qualifier until such time as a vaccine is made available to the worker. If I may have the second motion. Sorry, Madam Speaker, I'm just waiting for the second motion. Just want to acknowledge. Thank you. And the second one replaces recommendation number 3, which deals with the sick leave provisions. And if you can scroll down, it asks the government to update their emergency management plans to deal with supporting people. You can just see those words. So, Madam Speaker, unfortunately, we've gone off track on this debate. I find it very frustrating. I find council's doing what council does best, is acting like the tail wagging the dog. And I'm very concerned with some of the things that I see here. And I am not satisfied with some of the answers that I got on questions I asked about why is it 5 days? Why is it 10 days? What happens if it's a part-time worker? What if their workers working 2 jobs? Do they get 10 sick days, 5 from each employer? I mean, I don't know. And there's a reason the staff didn't seem to know either, is because that's not our area of expertise. We don't write the checks on this. The other orders of government do. And so I don't have a problem with taking a position of a council saying, governments, we think you should do more, especially in an emergency, to support workers and take away the money out of the equation when people make bad choices about whether or not to go to work if they're not feeling well. And actually there's a very good argument to be said about that, especially during the pandemic. But I think the right place to address those type of issues is in the provincial emergency response plans. And they need to build mechanisms that are very general in nature. Who knows what the next emergency could be? It could be some other type of a thing that requires workers to stay home or people need supports. And having those mechanisms in place for the government to move quickly on them is the right thing to do, and is right to plan for those, and it might even be right to make those changes during this emergency. And we know that the federal government provides some forms of benefits, and the report was very good at articulating that maybe there are some deficiencies in the speed that the money comes to people, and maybe the amount, $500 per week, maybe that's not enough. And I think it's a fair ask to say that maybe more needs to be added. But there needs to be limitations on that. Now imagine what our small businesses would say if we were consulting them about taking this policy position. 5 paid sick days is almost a week for a particular employee. So if you're a small store and you've got 1 or 2 employees, you now need to plan for an extra week's worth of salary for one of those employees in case they call in sick, because you've got to backfill them with somebody else. And you know what ultimately happens though? is that instead of getting a raise in the future, if this thing goes through, perhaps the employer will scale back on that. I mean, it's always a zero sum. There's only so many places that the money can be found. I just think it's ill-advised for us to be taking a position on a policy of that nature, given the knowledge that we've got, given the circumstances. I mean, this is forever. This is not about the pandemic. This is about a future provision of the Employment Standards Act. You know, again, I asked the question about why 10 days, and it seemed to be because that's what we got from the COVID experience. I mean, what if the next pandemic, and let's hope that's 60 years from now or more, you know, what if it's 30 days that you're sick? What if it's 2 days? And I don't know, it just seemed to me to be a number plucked out of the air. So what I'm trying to do with the motion here is just take the position of, you know, there's a better way to do this. Perhaps there are some mechanisms for the provincial government to build in how it handles emergencies, to supplement, to augment, to try to support workers who are without pay and take that out of the equation. But I find it disturbing that we've gone down this path with our particular discussions today. And I didn't get a lot of confidence in, you know, in the policy routing on why these numbers were selected and why one is a permanent benefit and why one has to do with only during the sick period. Thank you, Madam Speaker.
Thank you. Councillor Carroll to speak. Councillor Carroll?
Sorry, Madam Speaker. I thought there were going to be questions. Madam Speaker, I don't have a motion to move. I won't be supporting the motions that were just moved. The ones previous to that are the ones I prefer. But we've really only just touched the tip of the iceberg here. And I'm not speaking to just other orders of government. I am speaking to employers. And you know, I really, really want to echo Councillor Wong-Tam in her compliments to Councillor Thompson for moving that employers have a role to play here. I guess I've been around long enough that there are lots of people on council now that are sadly so young they don't remember when paid sick leave was a thing. When you didn't even have to organize a union. You got paid to go home to keep the rest of the workforce healthy. And we're really only touching the tip of the iceberg in this. Consider what is happening in real life. And I'm talking about my community now, because currently the highest per capita transmission neighborhood is in my ward. It's a vast census area known as Henry Farm that includes Henry Farm area, but also an essential worker neighborhood in Parkway Forest, new condo neighborhood in the Consumers Road Business Park, and a lot of essential workers, from high-paid doctors in Henry Farm down to people who are driving cabs that we all need. And consider the scenario: you're at work and your teenager calls home. Remember that high transmission before Christmas? Your teenager calls you at work and says, I just tested positive. And this is where I was going when I asked the questions about stigma, because if you're in one of those jobs with no protection, your first thing you say to the kid is say nothing, post nothing. I don't know what will happen to me when I come home to take care of you. And if I say that you have it, whether you're asymptomatic or not, I must stay home for 14 days and I really can't. So now I'm going to go back to work because I don't have paid sick leave. And I may not be positive, but 2 days from now, I probably will be positive. And by then it's too late. I've infected my workplace. So asking questions at this late stage in council, such as, do we have proof that people catch this in the workplace? That was one of the questions today. You catch it when you leave home, and you spread it when you're afraid to say you have it. And paid sick leave is at the heart of why people are afraid to say they have it. They're even afraid to say that a member of their family has it. And that's why we cannot get control of this. Paid sick leave, with employers taking a part in it, small, medium, or large, and the government shoring that up, is how we're going to get rid of this. There are families out there where it's not just the worker. Anyone in the household getting it means all of them need to quarantine right now, and most of them are afraid. All of us have at least one neighborhood where that whole family is being culled together right now by 4 or 5 desperate part-time jobs wherever they can get them. And so the infection goes wherever they go. However seriously they can afford in their desperate current circumstances to quarantine, which for many is not much. That's why we're looking at these paid sick leave motions. And I would suggest that we support the earlier ones, not the latter one. Thank you, Madam Speaker.
Thank you. Councillor Layton to speak.
Yes, thank you very much, Madam Speaker, and I'll be very brief. I just wanted to say, for the past year, this City Council, this body, an extremely good record of supporting our medical professionals in their advice to us for implementation. I would urge all of you to.
You're cut off, Councillor Layton. Councillor Layton.
Continue.
Councillor
The connection is cellular, is that?
We can't hear you, Councillor Layton. Can you shut your video? Shut off your video.
Can you hear me now, Madam
Yeah,
Speaker?
yes, I can hear you.
Then I'll finish my remarks by saying we have spent a year following the advice of our medical professionals. Let's continue that very positive record and don't support the recommendations from the Deputy Mayor, but instead let's continue to follow the advice from our medical professionals. Thank you.
Thank you. Okay, so that's it for the speakers. If we can put the motions on the screen. Councillor
On a
Thompson.
point of order, Madam Speaker,
Yes, Councillor Holiday.
should my amendment to replace a recommendation 3 not pass, I would request that I vote on 3 separately in a recorded vote.
Okay, so can I ask Councillor Thompson to speak on the revised motion, please?
Oh, sure, Speaker. Thank you.
If you can place it.
Can we put it up?
Just place
Sure,
it.
yeah. So here it is. So I want to thank Councilor Cressy and Councilor Perks, and through the questioning and so on, we've cleaned it up a bit. And so it now reads that City Council requests the Government of Ontario and Canada to consider enhanced and extended paid sick leave options over and above the recommended 10 days for employees with long-term COVID complications. And as I had said earlier, there are many cases where that is the case, and we want to ensure that employees are not going to feel that they will have to return to work and then continue to spread the virus. And we want to ensure that they could be helped at the same time, as we know that many of these people have families and so on that are relying on them. And we should have some mechanism to help.
Thank you. Okay.
Thank you, Speaker.
Okay, the first motion is 4A by Councillor Holiday.
Could I ask for a recorded vote on that, Speaker?
Yes.
Councillor Fillion, could you state your vote, please? It looks like you haven't received it to your screen. Councillor Matlow,
Councillor
please.
Crampton, affirmative. I didn't get the vote.
Councillor Grimes in the affirmative. Thank you. Now, Councillor Fillion, are you present and voting? Your video is turned off to us here in the chamber.
I think he's frozen.
And Councillor Fillion, if you can hear me, maybe if you turn your video off, we can at least hear your audio, please. Councillor Perruzza, are you present and voting? We see your video is off here in the chamber.
It's Councillor Grimes. Can someone contact me? My screen seems frozen.
Councillor Grimes,
Yeah,
we heard that.
my vid on, my mic is on, my computer's on. I can't get the motion on the screen.
So, Councillor Perruzza, how do you vote, please?
In the affirmative.
Thank you.
Clerks, John, I just spoke to Councillor Fillion on the phone. He is having trouble accessing to vote, just so you're aware. He is desperately trying to log on.
Did he tell you how he votes?
Madam
That's
Speaker,
not for me to say.
Madam Speaker, we'll just wait 1 second to see if we can connect to Councillor Fillion.
Yeah, and the same with a point of order, and far be it from me, Madam Speaker, but I would think if Councillor Perruzza did have that motion in front of him, I would question whether he might be asking after to have his vote reconsidered. So we should make sure he can see the motion he's voting on.
I can't see the motion. I don't know. I can't see the motion.
It's Councillor Fillion. Can you hear me now?
Councillor Fillion, yes. How do you vote, sir?
Yes, I'm voting in the negative.
Councillor Fillion in the negative. Thank you.
Yeah. Can I get the motion, please, before I finalize my vote?
Madam Speaker, unfortunately, it's not possible for us to override the vote screen or show the motion while the vote is open.
Speaker, I'm feeling very uncomfortable at this. There are a series of motions here that impact one another and people are unable to get in the portal. Should we go to Timis or will people find the motions there? Because you need to see them all to know which ones to vote in the negative and which ones to support.
Yeah, why don't you just read out the motions and ask us to vote, since the system's not.
If I can please ask members of council to keep it down for a minute, and rather than everyone speak at the same time so we can get this straightened out. Okay, the motion is on the screen.
No, so you want my vote again?
Madam Speaker, on a point of order as well.
Yeah, we're in the middle of a vote. Councillor Holliday, what's your
I
point of order?
realize that. My point of order is I would just ask that you limit the dialogue of members because some of it may be construed as influencing the vote.
But
I understand the technical limitations, but if you could just be mindful of the chatter.
I just said that a minute ago. Ask members of council to keep it down.
Madam Speaker, Councillor Grimes, point of order.
Yes, Councillor Grimes.
Madam Speaker, I'd like to change my vote to the negative, please. I'm sorry. I think I was voting on something else because I haven't got the. Now I see it now. I'd like to change my vote to the negative.
Madam Speaker, I too want to vote against this motion.
Yeah.
Point of order, Speaker.
Oh, okay, we have to stop with the point of orders because we're trying to get things
Well,
straightened out
no,
here.
we're not. No, Madam Speaker, we're not going to stop with the point of orders with great respect, Madam Speaker. But we can. But, are you not going to allow then anybody to speak rather than a point of order? Is that?
No, it's not that I'm not allowed it. The clerk has asked if we can have some quiet so we can
Okay,
straighten things out.
well, let's get the vote finished and you can recognize me when we're done.
Yes,
That's fine. No problem.
because they're having difficulty here, so that's why I'm asking that we kind of keep it down until we get this straightened out.
Yeah.
Madam Speaker, the motion does not carry. The vote is 5-19.
Okay, Mayor Tory, you had a point of order?
Well, it's more likely a point of personal privilege. I just would like to say that in response, because I suspect the Deputy Mayor Holiday was making reference to my comments, and my comments were only aimed to expedite the meeting so that we didn't have to have a revote.
Hello there.
Because
Okay, somebody's just talking on the phone now.
That's Councillor Grant.
Okay, Councillor
so
Grant.
I
Okay,
was,
I'm sorry,
if I
Mayor
was debating-
Tory. I can't hear you
It's all
now.
right.
There's too much distraction
Okay.
here. I'm sorry.
Okay.
Okay, go ahead.
I was only commenting on the fact that I was pretty sure, since Councillor Prutza couldn't see the motion, that I was pretty sure I could lay a bet 9 times out of 10 that he was voting the wrong way. And my concern wasn't with how he voted. He can vote whichever way he wants, obviously, but that we would end up having a revote because he would see after that he'd voted the wrong way. And I think that that's the folly really here, is that we should ever conduct a vote where we can't see the motion. That speaks to Councillor Carroll's point as well. And I know the staff are working very hard at that, but I certainly can't accept any suggestion that my comments certainly were an attempt in any way or could be construed as trying to influence anybody's vote. I just wanted to avoid a revote. Thank you.
Thank you.
And Madam Speaker, on a point of personal privilege,
Point of personal privilege, Councillor Holiday.
yes, I only believe that all members have acted honorably in this process. I just realized that sometimes the way that votes time out and occur, they can change things around. It's just my experience in the chamber, and I would never suggest any members were doing that.
Okay, and, I want to apologize to members of council, but when we had 5 or 6 members of council, point of order, point of personal privilege, and we have staff here that's trying to straighten out the motions, it's difficult to hear when everybody is speaking at the same time. So, thank you very much. So we'll put the next motion on the screen. 4B by Councillor Holiday.
Vote, please.
Recorded vote?
Councillor Bailao, please. Thank you. Councillor Pasternak, your vote, please. Councillor Filion, are you connected, and can you tell us your vote?
1 second. Not yet. It's going for antivirus. Grimes in the negative.
I apologize. I was trying to get reconnected and I didn't see the motion on the screen. If it's possible to see that.
Yeah. Councillor Filion, when you're ready, would you please announce your vote?
Negative.
Thank you. Madam Speaker, the motion does not carry. The vote is 2-22.
Thank you. Next motion. Motion 1A by Mayor Tory. All in favor, show of hands. Carried. 1B by Mayor Tory. All in favor, show of hands. Carried. Motion 2. By Councillor Mantis, all in favor, show of hands. Carried. Motion 3 by Councillor Thompson, revised. All in favor, show of hands. Carried. Yeah. Councillor Holliday has asked that part 3 of the item be a recorded vote, so we'll have a recorded vote on part 3.
Councillor Pasternak, please. Madam Speaker, part 3 of the item carries. The vote is 24-2.
On the item as amended, all in favor, show of hands.
Recorded.
Recorded vote.
Madam Speaker, just stand by. We're about to start the vote in a second. Voting panel is now open, Madam Speaker.
The voting panel is on now.
The balance of the item as amended carries unanimously, 26 in favor.
Okay, thank you very much, and thank you to staff especially. It's been a very stressful day. I want to thank members of council for your patience. And, you know, as I mentioned earlier, it's very difficult for us here when we have distractions and number of councilors speaking at the same time. Thank you very much for your patience, and let's move on to the next item, which is 25.5. Do we have any questions on the item? If you do, if you can please put your name on the screen. This is the Student Nutrition Program. Councillor Thompson, questions?
Yes, Speaker, thank you.
Thank you.
I just wanted to understand what is the the difference between the format. In the report, it talks about the particular formats for meals. I think one is the breakfast program, and the other is let me just find that here. Just part of a temporary introduction. There's a morning meal and there's a breakfast program. I wanted to understand what the differences are between those two programs.
So through the speaker, at a very high level, the major difference is this. With the breakfast program, it does tend to be a meal that is served in a congregate setting to a smaller number of students, whereas a morning meal program is one that can be provided for in classroom and tends to be something that is a whole school endeavor as opposed to just a specific small group of students.
Right. Okay, that's very helpful. So during the pandemic and the closure of schools, how are we helping those students who were dependent on receiving a morning meal and or part of the breakfast program? How are we helping them now?
So through the speaker, actually, this is, while Toronto Public Health is certainly a key partner in this, a lot of the innovation really comes from our partners out in the community through Student Nutrition Ontario Toronto and the foundations that actually support the student nutrition programs. So there were a number of different methods that were deployed. Sometimes things like giving gift cards or grocery cards to allow for families who need that support to be able to purchase their own food, while online schooling or the lack of in-person schooling was happening. Sometimes there were options for what we called grab and go food items and food options. These are the kinds of things that were provided for. And again, each one of the different circumstances gave rise to different kinds of innovations. And I would say that our community partners really rose to the challenge in that regard.
Fantastic. Thank you very much. Those are all my questions, Madam Speaker.
Thank you. Councillor Cole, questions?
Yeah, Dr. Davila, just Councillor Thompson triggered a question in my mind. We have hundreds of thousands of seniors stuck in little apartments all over the city. Are we keeping tabs on any Meals on Wheels programs and whether our seniors are able to get proper nutrition through this year-long shutdown?
So through the speaker, Councillor Cole, my colleagues from SDF&A may be better positioned to speak to the kinds of community resources that have been put into play. I'm not sure if they're on the line right now, but certainly I know that this has been the subject of much conversation and work at the community tables that have been meeting since early on in the pandemic. The specific details I may turn over to my colleagues.
Sure. Thank you, Dr. Davila. Through the speaker, so Dr. Davila is absolutely correct. When we started the TO Supports COVID equity work at the beginning of the pandemic, food security and food access was one of the most immediate needs articulated by a range of Toronto residents, including food banks struggling to be able to stay open, and growing needs among seniors with isolation and a number of populations. So we have been steadily supporting a variety of food programs through the Red Cross, through food banks, through community-based agencies to deliver food to seniors, food hampers, prepared meals. This has become a significant new area of work for the city to support the food delivery system in such a direct way, picking up on work that public health has historically been doing through the food network. Dr. Davila can clarify the name of that food network. But we certainly see a continued need. We have been spending millions, to be frank, on this particular need through our TO Supports Investment Fund, which is largely provincial funding, and have been refining that work, particularly to ensure that healthy food and culturally appropriate foods are part of the delivery.
Okay.
Yeah, you're a busy person, Ms. Campbell. Yes, you're everywhere. Anyways, I'll follow up with more details, but I just wanted to make sure that, our Meals on Wheels programs across the city.
Okay, Councillor
Yes?
Cole, I have to interrupt here. We are talking, the item we're talking is student nutrition program. That's the item.
We're talking about nutrition. Don't you care about the seniors?
No, but it's
You always used to.
No, but the item is to do with the student nutrition program at the schools. I'm sorry, I understand Meals on Wheels seniors, but that's not what we're talking about now on this item.
Okay, I'll get the information offline and I'll share that with you, Madam Speaker. I know you're interested in seniors.
Yes, since we're all seniors. Thank you. Councillor Pasternak, student nutrition program.
Yes, no, I'm very familiar with the student nutrition program. Thank you very much, Madam Speaker. Through you to the Board of Health. Now, I don't know whether it was answered before, but my notes indicate that we have the municipal contribution is about $15 million. And the schools have been closed for 6 months. Now, can surplus dollars or unused dollars be rolled over to the next either school year or fiscal year to make up for any kind of extra needs? Can we expand the program? What's the plan with unspent monies?
So through the speaker, if you look carefully at the report, that's exactly what we did. The idea here is to try to meet the needs of the students as best as possible, given the frankly unprecedented circumstances in which we have found ourselves.
Well, that I understand, but the whole design and structure of the program is to do it inside a school setting, although we do have some recipients who are in community centers and some kind of other social halls. So if the schools are closed, how do you spend those dollars? How do you find these students?
So through the speaker, again, this is the remarkable work that was done by many of our partners that are involved in the student nutrition program. Certainly the provision of grocery cards. I mean, again, our schools are quite familiar with their populations, thankfully, and are able to really support the appropriate allocation and understanding of how best to meet the needs of students in the school. So there are a variety of options and different methods that were used by the schools, but I would suggest to you that the most frequently turned to ones included such things as the use of a gift card in order to allow for people to purchase their own food and to meet their nutritional needs that way. And of course, that required more money, because when you're buying at the individual level, you don't have the same buying power as might be experienced when we're buying for an entire school per se, or for a whole program. So that needed to be accounted for as part of the spending. As well, we talked a little bit, or I mentioned a grab and go option. There were some options, particularly for older students who are a little bit more mobile and independent. They can drop by, pick up some food, and that provides an option to purchase food on a larger level, perhaps use a little buying power that way, and still provides nutritional support for those who need.
So last question, we have private sector partners who contribute to our student nutrition programs. Are they still with us? Or, I mean, with the schools closed, are they still contributing, keeping up with their historical contribution?
So through the speaker, I don't know the exact level. I don't have that figure with me, Councillor. I do apologize for that. But my understanding is that there are still private sector partners, excuse me, that are contributing to the program and ensuring that the program continues to be successful and is able to provide and meet the needs of students who have those needs.
Okay, thank you. Thank you very much, Dr. Bell and Madam Speaker.
Thank you. Councillor Fletcher, question?
Yes, thank you. That $15 million actually goes, as I understand it, directly to the foundations. Toronto Public Health does not actually purchase any food directly. And the allocation of that food is determined through the Toronto Foundation for Student Success and the Angel Foundation. And so during this pandemic, have you had an accounting of but Toronto Public Health, of course, knows every school, how much money has gone there. Have you had the accounting from the Toronto Foundation, both of the foundations, directly back to you as to how those allocations have proceeded in each of the school settings that have not been school settings for quite a while? And of that $15 million, how much was not spent last year?
So through the speaker, sorry, Councillor Fletcher, I hadn't realized you weren't finished. So through the speaker, I will have to get those specific details for you after the meeting, Councillor Fletcher. I do not have those figures with me.
We do get through the various boards. We understand about which schools have received food, what they've had. I think that accounting would be very important. And it would be surprising if all of those dollars had been spent of the 15 million. I think we should understand what's there. Also, if some of those gift cards, they wouldn't be given out at the school if it's not open. Where are they being given out? I'm a big advocate of student nutrition and very interested in how this has been run. I think every councillor is for their ward, and we do get ward advice, and I would ask you in your off time, which I know you don't have any, but if somebody who's on that program could please forward all of that information to us, it would be very helpful.
Okay, through the speaker. Thank you, Councillor Fletcher. I'll make sure to speak with the team.
Thank you.
Okay, thank you. Okay, we'll go to speakers now. Councillor Cressy to speak.
No, Speaker,
Sorry, I think Councillor Filion has been bounced off and he can't get back on. He's just texted me to tell me that. I thought I should let somebody know. Thanks.
Well, hold on. Does Councillor Filion, does he have a question?
Not having access to council meeting.
Okay, well, hold on.
You, Madam Speaker, so you can work your magic, or clerks. And I'm sorry to interrupt you, Councillor Cressy. I'm sorry.
Okay, so we're working on it. Okay, let's go to speakers now. Councillor Cressy to speak.
No, I'm happy to simply move the recommendations in front of us, and with deep thanks and gratitude to staff.
Okay, thank you. Do we have any further speakers on the item? No? Okay, so on HL 25.5, on favor? Show of hands? Carried. Thank you. So that item has been completed. So we now go to members' motions.
Deputy Mayor Minnan-Wong, are you wearing a tie seated in your office there? Very official.
I'm trying to look good for you, Paula.
Seated.
You better keep trying, Denzel.
MM 28.1.
Sorry, can we find out if Councillor Filion is back?
We're working on it.
Or what's, you're working on it?
Yeah.
Okay.
That's all I could say at this point, Councillor Fletcher.
Oh, boy. Okay.
MM 28.1. Notice if this motion has been given. This motion is subject to referral to the Toronto and East York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.2. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.3. Notice if this motion has been given. This motion is subject to referral to the Toronto and East York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.4. Notice if this motion has been given. This motion is subject to referral to the Economic and Community Development Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.5. Notice if this motion has been given. This motion is subject to referral to the Planning and Housing Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried. On the item.
Recorded vote, please.
Pardon?
Recorded vote, please, Madam Speaker.
Recorded vote.
Councillor Pasternak, please.
Unfortunately, the voting utility is not popping up on my screen, but I'm in the affirmative.
Thank you. The motion carries. The vote is 24-1.
Thank you. MM 28.6. Notice if this motion has been given. This motion is subject to referral to the Striking Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.7. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor?
Speaker, may I
Carried.
have a recorded vote, please?
Recorded vote.
Thank you.
Councillor Perruzza, please. The item carries unanimously, 25 in favor.
Is that Councillor Bradford holding a baby?
Are we going to have a baby show?
I thought we were going to have a baby show, Councillor Bradford.
This council meeting's putting her to sleep.
Hold her up. Hold her up. Show that baby off COVID style.
Come on, Councillor.
Oh my God. Hello.
Okay, members of council.
Back to work. Back to work.
Yeah, if I can just, if we can wait for a couple minutes, and the reason for that is we're going to try to get Councillor Fillion on the phone because he's not connected. He's being recorded as being absent, and he may want to, especially the ones that we have a recorded vote, he will be recorded as being absent, and we don't know what his vote would be on these items. Is that okay?
That's fair. That's very fair, Speaker. Thank you. And Brad, I'd like Breyer to vote on some of my motions, please. Thank you.
Is he on the screen?
Councillor Fillion, can you hear me? And if so, can you confirm that you've connected?
It's Councillor Fillion. Can you hear me?
Yes, we can hear you. Can you hear me?
Just 1 minute, and I will be able to.
Madam Speaker, I would move to reopen any of the votes if Councillor Fillion
I can
vote on them.
Okay, can you hear us now, Councillor Fillion?
I can hear you, yep.
Okay. Well, maybe if we can just record him on how he wanted to vote, huh? Okay.
Yes, I'm sorry, I've had no video. So what's the motion?
Okay, we've had 2 recorded votes on members' motion 28.5. About immediately reinstating a province-wide residential eviction moratorium. We had a recorded vote on that. So do we want to reopen that item so you can vote on that, Councillor Fillion?
No, it's okay. If the votes weren't closed, just carry on.
Okay, so we're at MM 28.8 now. Notice,
you.
notice of this motion has been given. This motion is subject to referral to the executive committee. A two-thirds vote is required to waive referral. All in favor of waiving referral?
Recorded?
Okay, recorded vote. Recorded for the referral or on the item?
Sorry, on the item.
Okay, on favor of waiving referral? Show of hands?
Madam Speaker, on a point of order,
Yes.
it's Councillor Wong Tam. The motion on the screen is not the motion I believe that we're voting on. MM 28.8 is being tied to the executive item.
Okay, so Councillor Wong Tam, so can you move to withdraw this motion then?
Oh, I see. Yes, I can move to withdraw the motion.
Okay, on favor of withdrawing the motion, MM 28.8. Thank you. Somebody has, there's noise. Mute your mic, please. Members? Okay. MM 28.9. Notice of this motion. Notice of this motion has been given. This motion is subject to referral to the executive committee. A two-thirds vote is required to waive referral.
Recorded?
Recorded? To waive referral.
Madam Speaker, sorry, I apologize. It's Councillor Wong Tam again on another point of order. The motion on the screen is not the most recent motion. I did send in a revision after working with the mayor's office on an amendment. Perhaps the clerks can find that motion.
It will be treated as an amendment, but in order to do that, we need to waive referral and have the motion on the floor.
Thank you very much.
Okay. Recorded vote to waive referral.
Councillor Fillion, how do you vote, please?
In favor.
Thank you. Councillor Perruzza, your vote, please. The motion to waive referral carries. The vote is 19-7.
Okay, so we'll hold the item down. MM 28.10. Notice if this motion has been given. This motion is subject to referral to the Board of Health. A two-thirds vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.11. Notice if this motion has been given. This motion is subject to referral to the Toronto and East York Community Council. A two-thirds vote is required to waive referral. This motion relates to a Toronto local appeal body hearing and has been deemed urgent. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.12. Notice if this motion has been given. This motion is subject to referral to Toronto and East York Community Council. A two-thirds vote is required to waive referral. This motion relates to an Alcohol and Gaming Commission of Ontario hearing and has been deemed urgent. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.13. Notice if this motion has been given. This motion is subject to referral to the Scarborough Community Council. A two-thirds vote is required to waive referral. This motion relates to a Toronto local appeal body hearing and has been deemed urgent. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.14. Notice of this motion has been given. This motion is subject to referral to the Executive Committee. A two-thirds vote is required to waive referral. All in favor of...
May I have a recorded vote, not on the waiving it, but the actual item, please?
All in favor of waiving referral? Show of hands. Carried. On the item, recorded vote.
Councillor Fillion, how do you vote, please? Councillor Fillion, how do you vote, please? Councillor Fillion, one last try. Are you connected, and how do you vote? Speaker, the item is adopted unanimously, 24 in favor.
Thank you. MM 28.15. Notice of this motion has been given. This motion is subject to referral to the Executive Committee. A two-thirds vote is required to waive referral. All in favor of waiving...
Recorded vote, please.
On the item or with the referral?
On the item.
Okay. All in favor of waiving referral? Carried. On the item, recorded vote.
Councillor Grimes, Councillor Wong-Tam, please, and thank you. And again, Councillor Fillion, are you present and voting?
If you can hear me, I'm voting in the affirmative.
Councillor Fillion in the affirmative. Thank you. The item carries 25 to 1.
MM 28.16. Notice that this motion has been given. This motion is subject to referral to the Toronto and East York Community Council. A two-thirds vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.17. Notice of this motion has been given. This motion is subject to referral to the Executive Committee. A two-thirds vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried.
I have a friendly amendment on this, so either hold it or I can move the amendment now. It's Councillor Robinson speaking.
Okay.
I haven't seen your amendment, Councillor.
Well, the clerk's up.
Okay,
We don't know if it's friendly, but in fact,
Okay.
I'll look at it.
It's very friendly.
Okay, we're going to hold the item
Okay.
down. We're holding the
No,
item
that's
down.
fine. Let's go with it. If it's.
We're
Why don't
holding the
we,
item
do
down.
we-
Including Thorncliffe Park, Councillor Fletcher.
Okay,
So go ahead and move it. That's fine. Yeah,
The clerks have it, if they could just put it on the screen.
Okay.
that's fine. We'll do that.
All right. Okay, let's, Counselor Robinson, what's your friendly amendment?
The clerks have it, but it's City Council reiterated support for a below-grade ground
Okay,
subway
hold
in the
on.
segment.
Okay, hold on. Do we have this amendment?
Yep, you've had it since yesterday.
No, apparently they're saying it's friendly, so we can do it. Okay, let's put it
How
on
do
the
you know
screen.
it's friendly?
I know it's friendly.
I'm just adding Thorncliffe Park, that's all.
Who's
Just
the
to-
friendly judge here?
Sorry.
If we're going to continue with
Can
this
we,
if we're going to continue with this dialogue, we're going to hold the item down.
Yes, I'd like it held down, Madam Chair. I have it, if Thorncliffe's Park
Okay.
is in there, Flemington Park needs to be in there too.
Okay, so let's hold the item down. Thank you.
Why don't
Put it
you
all
prepare
in,
that,
underground.
send it, and then that would be great. Thank you. And then we can do a quick release, Denzel.
Okay. Councillor Minnan-Wong had an issue with it too, so we'll hold it under Councillor Robinson's name. MM 28.18. Notice if this motion has been given, this motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.19. Notice if this motion has been given, this motion is subject to a reopening of item NY 13.1, and a 2/3 vote is required to reopen that item. If reopened, the previous council decision remains in force unless council decides otherwise. All in favor of reopening? Carried. On the item, all in favor? Carried. MM 28.20. Notice if this motion has been given. This motion is subject to referral to the Infrastructure and Environment Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item.
I'm going to hold that because I had a quick amendment from Mr. Baxter that doesn't appear to be here yet. So if you don't mind, I'll hold that. Thank you.
Okay, thank you. We'll hold it in Councillor Fletcher's name.
Thank you.
MM 28.21. Notice if this motion has been given, this motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried.
Hold. Denzel Minnan-Wong.
Okay, hold. '21. So 21 is held by Deputy Mayor Minnan-Wong. MM 28.22. Notice if this motion has been given, this motion is subject to referral to the Etobicoke York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.23. Notice if this motion has been given, this motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral?
Recorded vote on both?
On referral and the item?
Yes.
Recorded vote on the referral.
The motion to waive referral carries unanimously, 26 in favor.
On the item, recorded vote.
Councillor Carroll, your vote, please. The item carries unanimously, 26 in favor.
MM 28.24. Notice of this motion has been given. This motion is subject to referral to the North York Community Council. A two-thirds vote is required to waive referral. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 2825. Notice of this motion has not been given. A two-thirds vote is required to waive notice. This motion is subject to referral to the Executive Committee. A two-thirds vote is required to waive referral. This motion has been deemed urgent by the chair. All in favor of waiving notice? Show of hands. Carried. All in favor of waiving referral? Show of hands. Carried. On the item, all in favor? Carried. MM 28.26. Notice of this motion has not been given. A two-thirds vote is required to waive notice. This motion is subject to referral to the North York Community Council. A two-thirds vote is required to waive referral. This motion has been deemed urgent by the chair. All in favor of waiving notice? Carried. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 28.27. This motion is subject to a reopening of item NY 20.30. A two-thirds vote is required to reopen that item. If reopened, the previous council decision remains in force unless council decides otherwise. This motion has been deemed urgent by the chair. All in favor of reopening the item? Carried. On the item, all in favor? Carried. MM 28.28. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item, all in favor? Carried. MM 28.29. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item, all in favor?
Can I hold, please? Councilor Crawford?
Councillor Crawford, you would like to hold the item?
Yeah, I do have a motion for it, please.
Okay, just one moment. Thank you. MM 28.30. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda before council for debate. On the item, all in favor? Carried.
Recorded vote.
Recorded vote.
The item carries unanimously, 26 in favor.
MM 28.31. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda before council for debate. On the item, all in favor?
Oh, Madam Speaker, I'm sorry. I thought we were voting on the referral. There is a motion to be placed here. The clerks have it.
On MM 28.31, on 130 Bloor Street?
Yes.
Okay. Okay, so the motion is on the screen.
Essentially, it's to grant the alterations with a report back on a conservation plan.
Okay, so on the amendment, on favor? On the item on favor, carried. MM 28.32. This motion has been deemed urgent by the chair. This motion is not subject to vote to waive referral. This motion has been added to the agenda before council for debate. On the
Can we
item
see it on
on,
this? Oh, there it is. Okay.
on the item on favor, carried. MM 28.33. This motion has been deemed urgent by the chair. This motion is not subject to vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item on favor, carried. Okay, so that's it for the members' motions. Yes, so we have two more members' motion to introduce. Councillor Layton.
Yes, thank you very much. We have here to introduce a motion for 7890 Queens Park to give directions to staff to appear at the local planning appeal tribunal to try to negotiate a settlement with the community and the applicant.
Favor, carried. Councillor Bradford.
Thanks very much, Madam Speaker. Just waiting. There we go on the screen. This motion is to confirm the city's position to approve the consent application at the site. The matter is urgent because of the date of the TLAB hearing and the city's desire to indicate support for the consent application.
Okay, on favor, carried. Thank you. Okay, members of council, just need some direction. Yesterday, we had a timed item, i.e. 19.11, which is Young Tomorrow. And of course, we didn't get to it. And but also, there was a timed item following the members' motion, which is CC 28.10, which is the LPAT item to be dealt with immediately after members' motion. So is the wish of council to go to yesterday's timed item, which is IE 19.11, or go to the item today, CC 28.10?
Point of order, Madam Speaker. On the first day, I had timed the Downsview settlement as the first item after members' motions.
Yeah, that's the item. That's the item, CC 28.10.
Okay, I thought you were trying to juggle it back. Okay.
No. Well, yeah. So that's my question. Do we go to that item first, or do we go to yesterday's timed item? I'm just asking direction from council. What is the wish of council?
The LPAT seems more urgent to me. The LPAT seems more urgent than the other one.
Yeah, my item is very short.
Madam Speaker, it's Councillor Wong Tam on a point of order. I think that the matter regarding the Infrastructure and Environment Committee item was supposed to go directly after the mayor's two key items, plus the Foundry item. I recognize that if there's an LPAT item that is of absolute urgency and it is time specific and urgent, I can concede to that. We can deal with the Young Tomorrow item after the LPAT item.
Okay.
We'll just wait a little bit longer. It's been 10 years. What's a few more minutes?
Okay, so Councillor Pasternak, we will go to your item, which is CC 28.10. which is the Appeal 134 by Park Downsview Park item. So Councillor Pasternak, do you have questions?
I do, Madam Speaker.
Sorry, people have their microphones on that aren't speaking. I can see a number of them. Could we ask councillors to turn them off, please, speaker?
Yes. If you're not speaking, can you please turn off your microphone? It's very
Madam Speaker.
distracting.
Madam Speaker, point of order.
Yes?
This is the Downsview item.
Yes.
I do have a motion that I think needs to be moved in private. If staff can confirm, so.
Have you circulated the motion? Okay.
Staff has it since the beginning of council.
Okay, Councillor Bylaw, we're going to go to questions now, and then we'll sort out your motion. Because if we have to go in camera, then we're not going to be able to go in camera now. So, questions.
That's why I was bringing this up.
Questions, Councillor, can you please put your name on the screen for questions? Councillor Pasternak, you have questions?
I do. Thank you. Thank you, Madam Speaker, and thank you, members of council, for your flexibility in hearing this now. Let me know if there's any audio problems, and I'll turn off my video. So these are questions.
Loud.
I'm loud? Oh, okay. So through you to staff, will this settlement help build businesses and enterprise in the area that will not only replace Bombardier's workforce, but provide more jobs in the years ahead?
Sorry, can you hear me now?
Yes, we can hear you.
Yes.
It's Greg Lintern. I'm joined by our planning and legal team who've been working on this matter. And I'll just preface my remarks by saying that I'll be referring in my answers to the public report. Your question about jobs, the effort here has been to bring forward a resolution to this dispute, which is centered on building a complete community with a very, very strong economic function. So we're looking at a substantial number of jobs manifest through about 12 million square feet of employment space. So that would be the equivalent of tens of thousands of jobs.
Thank you. So will these settlement parks are obviously very important, and these lands adjoin the Urban National Park. Based on this agreement, will there be more parkland, city parkland, and whether they be municipal parks or the growth of the National Urban Park, does this create an opportunity for more parkland?
Through the speaker, we will be an area that includes connections. As you indicate, Park Downsview Park is right next door. So there's ample opportunity to build in both a whole system of open space, whether it be local, regional, connecting to existing parks, be very much shaped on a new landscape for the entire geography.
Thank you. So the communities, council adopted the goal of a community center in these lands 10 years ago, and it hasn't happened. Will this settlement help deliver a community center faster in the years ahead?
I think I'll have my colleagues from PF&R to answer that question.
Thanks, Greg, and through you, Madam Speaker, to Councillor Pasternak. We believe that, as it's structured right now, it certainly supports the community center discussions that have been going on for quite some time, and will assist in advancing those discussions and the actual construction of that community center.
Thank you very much. Now, the community is very concerned about heavy industry coming in. I understand this agreement or settlement does not allow for heavy industry. Is that how you read it?
That's correct.
So affordable housing is one of the city's top priorities. the agreement includes a good size of affordable housing, or at least a roadmap to affordable housing?
That's correct. It includes a roadmap as part of the secondary plan process, which will be the second stage. We'll develop a very detailed housing plan that will allow us to phase in and sequence in substantial amounts of affordable housing over probably decades of a build out in this area.
Now, the Downsview lands are separated by the railway tracks, and you have the east side of the tracks and the west side of the tracks. Hopefully, not the bad side of the tracks. Does this plan reconnect them by trails, bike lanes, roadways, green space?
Through the speaker, that will be a principle, a really strong, important principle of the entire secondary plan process that lies ahead of us, but making sure that this geography is well connected it is in the center of the city. There are so many opportunities to do that through a park system and a trail system, and certainly the road and other pedestrian and cycling connections. So that's work that lies ahead, but very much in our mind's eye.
Do you think this is a good deal for the city?
In my view, the outline in the public report of what we've been able to achieve so far sets us up for a good secondary plan process in the years ahead.
And what are the consequences if we don't settle?
Sorry, Councillor.
Can he answer the question?
That's your last question.
No. Could he answer the question? What are the consequences if we don't settle?
I prefer not to speculate in public. I think it's something that we're presenting to council that offers a good range of city building, a good package of city building objectives that we will advance into the secondary plan process in the next step.
Okay, thank you very much.
Thank you. Councillor Perruzza?
Thanks, Madam Speaker. I guess what I'm trying to understand here is, you mentioned we're going to do a secondary plan, and this leads to a secondary plan, and the secondary plan will look at all the issues, affordable housing, and all the other community objectives. The overall site was, as I recall, a little over than 1,000 acres. So a large chunk of it was, basically looked at for a park. I don't know, I think 400 plus acres basically turned into residential. It's got a secondary plan now, official plan, for housing. I believe somewhere in the neighborhood of 16 or 20,000 units that have been approved on this site already. And the balance of the lands that were left over were basically, industrial. Bombardier, obviously, at its height, they employed somewhere in the neighborhood of 7,500 people. I think they were responsible because they sort of fed an industry where some 20,000 plus people within the GTA, provided support services to Bombardier and so on. So I guess what I'm trying to understand is why isn't this being taken through the regular secondary plan process, and why would you make a change? I mean, what does it do? You make a change now where you say we're going to take it out of the we're going to change the employment designation to something different, and then take us through the secondary plan. Why would we do it that? Why would we welcome the tail before the dog?
Through the speaker. So this is a pretty standard approach, Councillor, that we would take across the city when we're dealing with employment lands redesignations. So this was, I remind Council, an appeal to OPA 231, which is the city's citywide employment policy. So as a first step, this move to regeneration settles the appeal. And then as a second step, we get busy on the detailed work of designing and developing a new community quite a large community, an unprecedented community in a way, around 3 subway stations. So it's a very, I mean, the decommissioning of an airport, this is probably the one and only time this type of activity would happen. And it is quite an evolutionary change for the area, but it is
No,
very much in keeping with the approach we would take in other sites.
So first, you would take employment land and say, we're going to designate them something different, and then you would proceed to do a secondary plan? Where have we done that before?
Well, two recent examples are the Mr. Christie's site in South Etobicoke and Celestica over Eglinton East, where we've, and some other examples across the city where we have settled the appeal and then again worked on the details of a secondary plan that guides and sequences phase development over time. It's a completely appropriate approach to take, especially when we have such wide-ranging objectives for this very large piece of geography.
Listen, I have a couple of questions related to the settlement agreement in terms of the land uses. I guess those questions would have to be asked in private, correct?
Beyond anything that I can comment on in the public report, yes.
Yeah, I'm just trying to understand the process. I mean, I'm fine with it. I'm certainly going to take the lead from the local councillor. I think Councillor Pasternak's been doing a very good job at this, and so I'm happy to follow his lead on this. But I did have a couple of questions related to the settlement agreement. Yeah. Okay.
I'm in council's hands if
Okay.
if you have more specific
Yeah.
questions.
We'll have to decide later. Okay, thank you. Councillor Cole. Councillor Cole.
As the southern neighbor of Councillor Pasternak, I'd just like to ask Mr. Lintern if this settlement in any way impacts the possibility of relieving the city's largest bottleneck at Yorkdale Plaza, where we want to extend Dufferin through the Bombardier site north to the Allen Expressway. Will this impact on that potential relief line for the future?
Through the speaker, Councillor, you raised a couple of interesting points. One is that Yorkdale is subject to a separate planning exercise that we're engaged with currently that is looking at the traffic and transportation impacts in and around the mall. But also, as you can imagine, with this Downsview project and the revisiting of the Downsview secondary plan, there will be an accompanying transportation master plan that will look at the appropriate road network and other transportation demands on the entire area and match that up with the land use plan that we intend to lay down. So I think you're raising important objectives for the work that lies ahead.
So, but this doesn't really impact that potential relief road through Bombardier lands.
Again, I think it'll be on the table for the transportation master plan. There's no impact from council's decision to move ahead. There's no impact, and I would speculate that bringing these lands into the fabric of the city will actually afford many opportunities to deal with a lot of improvements. Actually.
Thank you.
Thank you. Are there any further questions on the item? Okay, we'll go to speakers. Councillor Pasternak, do you want to put?
No. Yeah, Madam Speaker, I got a couple of questions in camera.
Okay, so are you asking that we go in camera? Because if you are, then we have to hold the item down.
Can we do that, please?
Pardon?
Can we do that, please? Can we just go into camera now?
So Bishop Council, do we want to go into camera now? Show of hands.
When else would we go in, Speaker?
Well, I guess we
For
can,
this item only. Let's
I
move the
guess
motion
we-
on this item only.
I guess we can do it now or probably finish in camera. Okay, so we'll prepare a motion to go in camera.
Yeah, just a couple of quick questions, Madam Speaker. Nothing to be alarmed about.
Offline.
Should I move my motion, my public motion now, or wait till we come back?
No, you have to wait till you come back because we're still at questions.
Madam Speaker, there's a baby in distress on the line
Yeah.
there. Can someone attend to their baby, please?
Yeah, read the kid a book.
Hey, hey.
That's me, Councillor Cole, because of the,
It's
Oh,
not
I
that
didn't
easy,
know.
folks. It's not
When did that
easy.
happen?
Okay, members of council realize that we're live?
Oh,
Okay. Like, this is,
Barely alive,
this is
Speaker.
not a tea party. Okay, so Councilor Perruzza, if you want to go in camera, the motion's on the screen. Can you please read it? Councilor Perruzza, can you read the motion?
So Amir and Norcrest, they're all okay with their motion about inclusionary zoning?
Okay,
Madam Speaker, I think he may have stepped away because I think those were his kids having a bit of difficulty.
Councilor Pasternak, do you want to move the motion then?
I'm here. I'm just trying to unmute myself.
Yes, I'd be happy to move the motion.
No. Madam Speaker, I'm here. Can you hear me? I was just trying to unmute myself.
Okay, can you please read the motion?
Madam Speaker, I'm here.
Okay, can you read the motion? It's on the screen, Counselor. It's on
You
the
want me
screen.
to read the motion?
You need to read, yes, because you're moving the
that council
motion.
recess is public chat. Yeah. Sorry, Speaker. Yeah.
Okay,
That council recess, it's public. I miss the live meetings, Madam Speaker. I miss the,
This
the
is-
live interaction.
this has been the
The
longest,
council,
this has been the longest day for me.
that council recess, it's public
Oy
session
vey.
to meet as committee of the whole in closed session to consider, CC 28.10, local planning appeal tribunal, appeal of official plan amendment 231, appeal 134 by Park Downsview Park and Canada Lands Limited. Request for direction, reason for confidential information, litigation or potential litigation that affects the city or one of its agencies or corporations, and advise subject to solicitor-client privilege.
Okay, thank you.
And advice.
On favor, going in camera, show of hands. Carried. Okay, 5 minutes, we'll have a 5 minutes recess. Okay, members of council, we're back in public. City Council has completed its consideration of item CC 28.10. No motions were placed in closed session. We will now proceed with the public debate. Can I have speakers on Councillor Pasternak?
Thank you. Thank you, Madam Speaker. If my audio starts breaking up, I'll turn off my speaker, my video. I have a motion that I'd like to place, and I can run through it very quickly. This motion was drafted in consultation with us and city staff. These are motherhood issues. Obviously, support for the community center. If you're building a community, you have to have a complete community. And advising the General Manager of Parks, Forestry, and Recreation to work with the staff and apply for any kind of monies that may be available. Request the engagement process, which is very important because some believe this is the end of the story, but in fact, this is the beginning of the story. We want town halls, virtual town halls, groups, when it is safe to do so because it's a multi-year review to meet in person. We want the chief planner and executive director of city planning to apply the concept of the 15-minute city when doing site plan as part of the Downsview secondary plan. And of course, we want to prioritize the connecting of the two sets of Downsview, the east of the tracks and west of the tracks. We want to make sure that there's lots of parkland there, and that we want to make sure that there's continuity with the National Urban Park, that any development by the Federal Corporation Canada Lands includes parkland. So we expand the National Urban Park, and of course there'll be municipal parks as well. The site has a rich history. There's lots of history, and there's lots of geography. The geography, can you imagine as a councillor trying to manage 500 acres of vacant land? And that's what we're trying to do here. So it hasn't been an easy task, and I have a few minutes for prepared remarks. So the first thing I'd like to do is I'd like to thank the city staff. I'd like to thank Stephen Dixon and Jeff Cantos, Harry Rumakis, and the rest of the planning and legal teams. I'd like to thank the people of Downsview and groups like the Downsview Lands Community Voice Association, the York Center Senior Steering Committee, and of course, their support for this ongoing process, who want the best for Downsview, York Center, and of course, the City of Toronto. I'd also like to thank Councillor Michael Thompson, Deputy Mayor Thompson, who came to our meeting this past Monday, and spoke and seemed to be very supportive of the process. So when the dust settled in the last election, a lot of us inherited parts of our neighborhoods that we weren't all that familiar with, and one of the neighborhoods that I inherited was the Downsview, and it's been an honor to represent that neighborhood. One of the things I inherited was charting a future course for the Downsview lands, and right during that election, Bombardier sold their property to a holding company of the Federal Employee Pension Fund, and Bombardier is leaving in a couple of years, and that's why we're here. We have to plan for what happens to those 350 acres. And then the federal government would have had appeal for some time on the usage of their lands, which is another 150 acres. So, as I said, there's a lot of geography and a lot of history. But this represents an opportunity for Downsview, a new deal for Downsview, and an opportunity not just in Downsview lands, but also in the surrounding community. What is decided today does not close the door on the future use of the Downsview lands. The review of the Downsview secondary plan will take years, and I assure the community there will be extensive consultations. It will not be rushed. Every voice counts, and we want ideas, suggestions, and recommendations. We need to fix what went wrong in the current secondary plan, what worked, and what was left out. So this is, as I've said to the community, an opportunity that Downsview has. The community has asked for more parkland. The draft settlement that we're adopting today, that we could adopt today, opens the door to more parkland, both municipal park and national park. The community asked for a community center, and any settlement that is adopted today includes a roadmap to a community center. The community does not want heavy industrial, and no agreement going forward will allow for heavy industrial. The community wants affordable housing so their children and grandchildren can live in the area.
Councillor
And this
Pasternak,
plan,
your time's up.
yes.
Yeah.
What?
If you just want to wrap it up, Councillor Pasternak, your time's up.
Okay. So anyway, there's more work to do. Nothing can be built without the secondary plan, without park dedication. And I just wanted to thank all the groups that have participated in, and I look forward to these consultations and working with staff in the years ahead. So thank you very much.
Thank you. Councillor Grimes to speak.
Thank you, Madam Speaker, and I'll finish off Councillor Pasternak's speech for him. But just being very brief, just to put Councillor Prutz a little bit at ease, I'll be supporting the staff recommendations here. And Councillor Prutz will talk about the process. I wanted, as Greg Linton mentioned about the Christie's Light site in my ward of Park Lawn Lakeshore, I had the same concerns, but I can tell you, Carrie Bumbakis, I saw her on the line earlier today. Her and her team have headed that up. I had the same concerns that Councillor Prutz had. It happened at the Celestica site out in Scarborough. And it's been a really, really awesome process. And I can tell you that, the concerns that Councillor Prutz had, I had the same concerns. But Carrie Bumbakis and her team have been absolutely fantastic. And they have not gotten light on this applicant down at Park Lawn Lakeshore. So have some faith. This is just the beginning of the process. And it'll be a good process for Councillor Pasternak, and just wanted to put Councillor Prutz at ease on that. Thank you.
Thank you. Councillor Baila. Councillor Baila?
Yes, thank you, Madam Speaker. I do have a motion that was placed in the in-camera session that I'd like to move, and it was advance circulated. I want to start by thanking the local councillors, Councillor Pasternak and Councillor Prutz, and their communities that have been already engaged in dialogue about a site that, yes, it's in their wards, but it's 500 acres in our city. And the potential for all the areas surrounding it to also benefit from some of these community benefits that Councillor Pasternak was talking about, from parks infrastructure, from the communities that are going to be living in there. That if we want to maintain our workforce, our sons and daughters in our city, these are the communities that we have to build up. And so the importance of this work in a transit-rich area to create complete communities, to ensure that the community centers, the parks, the housing infrastructure, and the jobs are there so that we truly have complete communities. It's going to be a lot of hard work and I think very exciting work as well. So I would just like to tell the local councillors in the community that I think we're all here with them. And I also want to thank staff because I agree with Councillor Grimes that Carrie's team, when they work with the communities, and I also have a study in my area with the speaker, with Councillor Nunziata, they have been doing a great job in involving different parts of the community. This is a process that's going to take some time, and it needs to take time to get it right. It needs to take time to ensure that the voices are at the table, and that we truly create the environments to, like I said, create complete communities in an area that is already extremely well served by transit and surrounded by great communities all around. So we need to continue that community building in these lands as well. And so looking forward to supporting the local councillors on this work.
Thank you.
Thank you.
Madam Speaker.
Hold on. Councillor Prutz, you have a question on the motion?
No.
Okay.
I want to get on the speaker's list,
Okay,
but I don't have the right screen.
Yes, you are on the speaker's list. You're next. Councillor Prutz to speak.
Oh. Thank you so much, Speaker. I just simply, want to lend my support to the local councillor here. We have a wonderful opportunity in this part of the city, and I often, when I'm asked to speak about the potential of this region, I often point to the Downsview, the former Downsview base, the Downsview lands, of which I represented for quite some time, and York University, which is just really up the street. And when you take the combined acreage of the potential for this area in terms of growth, and when you look at, I often, when I either fly out or fly back, and haven't done that for a while, I'm looking forward to it, and fly over this area, I look at the highways that is traversed by this area, the 401, the 400, the 407 to the east, the 407 to the north, the 404 to the east, the rail line, the GO line, the subway line, the new LRT line, and so on. I see that the future of the the center of the GTA. It may not be the downtown, but it certainly has the potential to be a wonderful area, and we have this enormous potential to do some really good things. And I just want to make sure, as Councillor Pasternak, and as I'm assured by Councillor Grimes, that the process that we're undertaking is the correct one in terms of getting us to a good plan, to a plan that guides the kind of growth that A, is sustainable, and B, makes us all proud in terms of, how the city grows out, and this potential future center, with all the potential that it has, in linking up to York University and Seneca College and all of the other amenities that this neighborhood has. So in our excitement to get there, I just want to make sure that we have the right process at work that gets us at play, that gets us to obviously the best plan forward. I know Councillor Pasternak is eager, as I am eager, to realize this community center at the corner of Keele and Shepherd. It's very much in the plan, and we're still all sort of pointing the finger at each other in terms of who's going to do what and when. I think the sooner we get to that, the better, and I believe that there's some mechanisms in the existing plan on the other side to do that. But I also welcome the support of the group that is undertaken to develop and to see these lands grow, to support us in the efforts to realize that center. So I'm going to support what we have in front of us today and make sure that we get to the kind of plan that we all can support. Thank you.
Thank you. Councillor Cole to speak.
Yes, thank you, Madam Speaker. Yes, Councillor Perruzza is the western councillor there. I'm the southern councillor here to these lands. So I just want to make sure that whatever takes place here takes into account those people and those residents and those developments that are to the south. We can't be doing these major, massive developments, planning exercises in isolation. We must consult with the people who live certainly to the south of this. That's what I'm speaking for. If there is going to be some cohesion here, and I hope that all councillors, all bordering councillors are consulted thoroughly, and that we don't have this continual development process that takes place on one side of the street and councillors on the other side are not consulted. So I just want, and I'm sure Councillor Pasternak and I will collaborate on this, but I just want to make sure that is part of this process going forward, because Councillor Prusa talks about a community center there in Keele Street. Well, we need a community center in Wilson and Dufferin, right next to Lawrence Heights. That community center has been delayed by the province pulling its agreed 1/3 funding, and also the school board changing its mind about the plans for that community center. So when we're talking about a community center for Downsview, let's make sure that we take into account that to the south, you've got to look at this location, this community center that has to serve the people of Lawrence Heights. And then on top of it, we have an application in the Yorkdale plan to the south, bordering Downsview, where we're going to see 10 condos, residential dwellings go up on the Lawrence, on the Yorkdale parking lot. 10 more condos with thousands of units, thousands of people. Then across the street, the Holiday Inn to the south of this airport lands is being demolished, and there's 3 more towers going in there. So where are all these people going to, go to a community center? How are they going to get through that nightmare bottleneck at Dufferin and Yorkdale? I mean, we've had cops there directing traffic for 2 decades, and now they're going to add thousands of condos. And so again, whatever happens up here, I'm very supportive of this plan. It looks like a very comprehensive, well thought out agreement that's in place here that is beneficial for the short term, long term, for housing, transportation, hopefully. But I just really want to put on the record that we can't forget the abutting councillors and the abutting wards, especially mine, where there's all this development that's choking this area as we speak, never mind when they build the other 15 condos here to the south of the Downsview land. Thank you very much.
Thank you. Okay, I'm just going to say a few words. I do support the recommendation and the report, and thank you to the local councillor for working on this application. I know it's part of the new area that he represents now. And I agree with Councillor Bailão. We talked about creating communities, building communities, and Councillor Bailão and I are working at the St. Clair and Weston and Keele Street area as well, where that area needs to be redeveloped. So I'm in full support of the recommendation, and hopefully we can expand. And to Councillor Cole about getting other councillors involved, you mentioned Yorkdale. I'm just west of you, and I have not been consulted on Yorkdale. So hopefully you'll update me on your Yorkdale project. Thank you.
My Yorkdale project's not mine.
Okay, let's put the motion on the screen.
Sorry, may I?
Oh, sorry.
It's John.
Mayor
Yes, no
Tory, you
problem.
want to speak? Sorry.
I do, if I could. Thank you
Okay,
so much.
yes, go ahead.
First of all, I want to just join everybody else in thanking Councillor Pasternak. He's proven to be a quick study on something he did inherit, and I think has taken a very constructive attitude to, but one that I'll call, protective in that sense of that there is an existing neighborhood there, and that neighborhoods plural, and that all of those things have to be taken into account. And really, the hard work lies ahead. In the sense that, just like has been said a number of times, and we talked about this in the context of the West Don lands and why it's important for even the province, even with its own land and even with its MZO powers, to consult the rest of the surrounding areas, because it is putting a new neighborhood, a new development, a new community inside and a circle that's surrounded by a bunch of established communities. And that's planning, is not just planning one piece of land at a time, it's planning the whole thing. So I'm looking forward to working with him on that. But in that context, to get us to where we are, which is a significant step forward, I want to say thank you to the planning staff and to Greg Lintern, of course, but especially to Carrie Boumbakis, who I think has carried the laboring oar, and the team of people that worked with her. And I think this is just a major step forward. It's the beginning of a very complicated process. But what's interesting about it is that, unlike some other places we've sort of found our way to, which have all kinds of development and no transit, We start here doing this in a way that may not be the right way either, to have all these transit stations that are built and nothing beside them. But having said that, I'd rather have problem number 2 than problem number 1. We have 3 transit stations, 3 just TTC stations that are servicing this land. And what a great opportunity for us to do something not just good, because I heard the word good used. I want to see something extraordinary there. I want to see something transformational that takes advantage of the fact we have 3 transit stops, and they're there. They're there. We don't have to wait for them years and years and have people in all kinds of buildings that have been built where we say, don't worry, the transit's soon to come, which has happened in so many different instances across the city. And I think that the opportunity for us to build a community, you know, we are so lucky to have the development we've had downtown and all the people living down here, and they're lucky to live here, and I think they feel that way. But it also gives us a situation in which I think 40 or 50% of the people who live down here can walk to work. And we have now the opportunity to build another community where people can walk to work or can easily take transit to get to work. We can have more jobs on this site than were there before, more jobs. We can have housing, including a lot of affordable housing that we, of course, didn't have there before. And we can have the kinds of community facilities that Councillor Pasternak described. But the final comment I want to make is really just one that says this. I think the other thing that's really important about this, and the timing is perfect, and I'd say the same hopefully can be true of East Harbor. The same is true with the care we're taking and the high standards we're going to extract in respect of the Portlands, which is that we are going to need some things coming out of this pandemic that demonstrate confidence in the city. Confidence by all kinds of different people who will invest in this and who will come forward and make this a community that's worthy of taking note from right across the continent. We will need that. As great as I believe, and I say this all the time, Toronto's bones are, and that they're all still there, and all the things that made this a great city and one of the fastest growing cities in the world before the pandemic, we are going to have to demonstrate confidence. We're going to have to demonstrate it. We're going to have to attract it. We're going to have to build it up, even within the city where people have been hit hard by the pandemic. And I think this project gives us a great opportunity with the work that lies ahead to engage people and get them to help us design a community that is going to be extraordinary. By any measure, extraordinary within Toronto, extraordinary in Canada, extraordinary in North America, and do something that's really an example in a whole bunch of ways, including our objectives that we have with respect to climate change and sustainability. So I think this is a very important day, and I thank all the staff and the councillor and the private sector people that have been involved. And now let's make sure that this thing lives up to its advanced billing, which will be the hardest part. It always is. But we're starting with a very good start, and those 3 transit stations. I can't believe we're actually developing something where the transit in large measure is already there. What a blessing. What an opportunity. So thank you, Speaker.
Thank you. Okay, we have Councillor Bailão's motion on the screen. On favor? Show of hands.
Recorded vote.
Recorded vote.
Recorded vote
Yes, okay.
on everything.
Okay. Thank you.
Councillor Carroll, it appears that you haven't received the vote. Can you please verbally tell us your vote? Sorry, Councillor Carroll? How are you voting?
Didn't receive the vote. My vote is affirmative.
Thank you. Same thing, Councillor Fillion?
Affirmative.
Deputy Mayor Minnan-Wong, are you present and voting?
Yeah, you did.
Madam Speaker, the motion carries unanimously, 24 in favor.
Okay, on the item? Oh, sorry, Councillor Pasternak's motion, recorded vote.
Councillor Fillion, may we please have your vote verbally? Sorry, can you please unmute yourself?
In favor?
Thank you.
Motion carries unanimously, 24 in favor.
Okay, on the item as amended, recorded vote.
Councillor Fillion, how are you voting, please?
Favor?
Thank you.
The item as amended carries unanimously, 24 in favor.
Thank you. So we'll now go to our next timed item, which is IE 19.11, which is Young Tomorrow Municipal Class Environmental Assessment on Yonge Street from Queen Street to College and Carlton. Questions to staff? Do we have questions to staff? If you can please put your name on the screen. Councillor Wong Tam, do you have questions to staff?
I do, Madam Speaker. My screen was just spinning. Oh, it just came up. Thank you. I do have questions.
Councillor Wong Tam,
Thank you.
questions.
Thank you very much. And through you, Madam Speaker, to staff, with respect to the environmental assessment that is before us today, is it we need to get to 30% in terms of detailed design? Is that what's before us for approval today?
Through the Speaker, that's correct. The environmental assessment process is required for projects that include permanent changes to a roadway that permanently impact the future use or traffic capacity. The proposed changes in this case include relocation of curbs and drainage, and so approval of the EA stage is required in order for us to proceed further on the detailed design.
Thank you. And how critical is it for us to ensure that we have some type of council direction today, because we need to bundle this with the infrastructure work that's beneath the road, namely the failing water main? Is it absolutely critical that you are given direction today?
Through the Speaker, this is one of the oldest water mains in the city underneath Yonge Street, so certainly it does require state of good repair work in the coming years. So we need to proceed with the detailed design of the streetscape in tandem with the detailed design of the utilities underneath in order to meet the timelines of the water main good repair.
Thank you. And can you just give us a sense of the timeline? So once council approves this, what happens next?
Of course. So we have a supplemental report that was submitted, which provides a little bit more clarity on the timeline. The next phase would be the detailed design and operational planning, which would take place between 2021 and 2023, subject to council's approval of the EA stage that we are currently at. And then construction would take place following tender over the timeline of 2023 to 2025 plus.
Thank you. So today is really just about making sure we get the edges of the street correct. We have the dimensions of the roadways and that type of information. But with respect to the operational overlay, that happens afterwards. And is it the intention of staff to continue to consult with the community? Obviously, the pandemic has shifted the things around on the street. So post-pandemic, we may have different needs. Is it the intention of staff to continue that deep consultation with the community?
That's correct. So at the present time, we're seeking council direction on the physical design of the street only. There are some operational concepts that have been consulted on so far, but we require further consultation on those to reach a greater consensus with the stakeholders within the area. And so we would proceed with that consultation as part of the detailed design process in order to make sure it meets the future needs of this street in the COVID-19 recovery.
Thank you, Jacqueline. And just at a very high level, if you can describe some of the key findings out of the report. I think originally it was just in terms of the number of pedestrians to the number of people who are traveling by perhaps vehicles or perhaps even the physical conditions of the sidewalk. Is it safe? Is it friendly? Is it passable? Are there accessibility challenges today?
Certainly, through the speaker, we know Yonge Street is Toronto's most iconic street. Certainly, this section is very important from an economic vitality and sort of just cultural vibrancy perspective. Only 22% of the trips to this focus area are by driving. There's a huge amount of pedestrians in a pre-COVID condition that use this street, really spilling out over off of the sidewalks into the roadway when busy times are on. And between 50 and 75% of the people counted on the street are pedestrians. And so the only less than 25% of the street is actually used by pedestrians, is dedicated to pedestrians.
And thank you very much, Jacqueline. And finally, just two quick questions. I'm going to try to time it. With respect to the opportunities for greening and tree planting, new standards with respect to lights, can we do that right now if we don't change the widths of the sidewalk or any of the curb dimensions? Or do we absolutely need to have the wider sidewalks in order for us to do the street beautification, which includes planting of trees?
That's your last question.
The sidewalks as they currently stand are too narrow in order to provide more street-safe improvements such as street trees and street furniture to support businesses doing more patio space, that kind of thing. And so we need the widening of that pedestrian realm in order to provide those amenities.
Thank you.
Thank you.
Councillor Robinson.
Thank you, Speaker. To staff, my question is related to the layout of the site. So could you, if I was a pedestrian about to enter this area from the north end, can you just, Jacqueline, walk me through, pedestrian, cyclist, or motorist, just walk me through this site from the north end to the south? Just paint the picture for us. Once it's all implemented, what would it look like?
Sorry, so just if you're entering this study area at College and Carleton from the north end, we would be proposing to remove the 2 lanes of traffic. It would be consistently 2 lanes of traffic all the way from College Street and Carleton south to Queen. The pedestrian realm would be expanded, and between College and Gerrard, cycle tracks would be included within the design because this section of the right-of-way is 6 meters wider than the section south of College, the section south of Gerrard, which is 26 meters. So the more constrained area between Gerrard and Queen at 20 meters doesn't provide any opportunity to do more than expanding space for pedestrians. Between Gerrard and College Carleton, you have an opportunity to also provide a cycling connection between the existing cycle facilities within that area, in an area that has less retail vibrancy and more existing towers for pedestrians and residential use. So just to be very clear on the recap, there would be 2 lanes of traffic all the way from College to Queen, 4 meters of sidewalk all the way from College to Queen, and a 2.7 meter furnishing zone all the way within that area as well. So that is a consistent design for the whole streetscape, with the exception of the wider section between College and Gerrard would also have a cycle track.
Okay, that's really helpful. And so basically cars are permitted, but there's just 2 lanes now, correct?
That's correct.
Okay. And my understanding is from reading something today, I don't know if it was in the news or where I saw it, but the Eaton Center is not on board. how do you get them on board, or how do you compromise or meet them in the middle? Obviously, it's a big iconic part of the city. How do you address that concern?
Certainly, Cadillac Fairview and the Eaton Center has been an important stakeholder through the consultation process to date, and they will certainly continue to be in the stakeholder engagement process that needs to continue. I know some of the concerns that have been raised by Cadillac Fairview are in relation to some of the operational concepts, which, as I've stated, are not being requested to make any changes of council today. I know there are also some concerns about pickup and drop off within that part of the corridor, the frontage of the Cadillac Fairview and Eaton Center site. We certainly look forward to engaging further with them through the consultation process that is upcoming to address their concerns. I understand they're also concerned about turning movements at the parking garage that exits onto Shooter, and we've been talking with them about the details of those and would continue to do so during the design process.
And I was not clear on the gates and the bollards. I think there's lack of or we need a bit of clarification around that. So what are the in the report it talks about these gates and bollards? What are their purpose and when would they be utilized?
Of course. So the timing of installation of gates and bollards and the locations of them would be subject to further consultation. The time of use of them would not be determined yet. The purpose of them would be to facilitate flexible closures of the street at the time that council and the local BIA was interested in having those take place. So, for example, closures happen for special events at the present time. So any retractable gates or retractable bollards could be used to facilitate those and make the street more flexible. We heard resoundingly from stakeholders, including the Downtown Young BIA, that a flexible street that supported the kind of the festival activity was something they were looking for in this project.
Okay, so you say flexible, you don't mean permanent. It's not a permanent use. It's a flexible use to accommodate functions, festivals, events, street parties. Is that the concept, or markets?
That's your last question.
Yes, that's the concept.
Okay.
Thank you
very much.
Councillor Holiday.
Yeah, thanks, Speaker. Councillor Robinson got into where I wanted to go with that. I don't know if you can see it on the camera. That's figure number 18 in the report. That's the gate where it says example of automated gate in the HOG. Is that what we're talking about? I mean, that made it to the report. So what are we talking about here? Why is this in the report?
Through the speaker, there were certainly questions through the stakeholder engagement process about the types of gates or retractable bollards that could be used as we go into the detailed design process. So that example was provided to have clarity that we would be looking for a piece of street furniture that facilitated opening and closing per the needs of council and the local stakeholders through an operational plan in the future. It made it into the report to make it clear that it would not be something that would be permanently in place, that it would be something that could be flexible for the needs of the street design.
So there's a rollout map section on this. Those gates are on it. Are you telling me that those are off the table now? I mean, I don't understand. It's in the report, but now we're saying they're not there?
So Deputy Mayor Holiday, it's Barbara through the speaker. I just wanted to chime in to say that part of the reason why we have this operational plan at such a level of detail is because now we bring our EAs to council at 30% design, and we have done a significant consultation with a pretty broad range of stakeholders on this project. And part of what we have discussed is all the way through from design through operations.
Sorry,
what we're
Madam
asking
Speaker,
people
I
to
lost a
talk
bit of
about
sound
would be
here.
have flexible
I don't know if
the
it's my
street and-
connection or the general manager's.
Oh. It might be. Get my video and see if that's better. Is that better, Councillor?
Yes, that's better.
Is that better? Okay. So
right.
I was just saying that since we have such a significant level of detail, would you like to continue, or do you have another question?
Okay, you're cutting
I
off.
do.
You're cutting off.
So here's the other map in the report. I took the time to print it in color, and there's these red areas that say pedestrian priority. What does that mean?
Can you still hear me, Councillor? Deputy Mayor Holliday?
Yes.
I can, thank you.
Go ahead, Jacqueline. I think my video is... You can, okay. So in the engagement with those teachers is understanding that there's a significant interest in having a flexible street. And there's also lots of times during, so certainly building up the sidewalk infrastructure, but also there are a lot of festivals and events that happen. And there's certainly an interest in making sure that the street is flexible and can be used in various areas for pedestrian priority. But those operational details are not what the council is being asked to discuss today. In fact, they are still very much in flight, and the detailed design and consultation that will happen between now and when the project is complete is when there will be much more discussion and fleshing out of those concepts.
So why are they in the report, though? I mean, it says right here, vehicle management and emergency service access from 6 a.m. to 1 a.m.
As I mentioned, Councillor, we bring these reports to 30% design, which means that we have a level of certainty around impact and cost that we believe the council needs to understand. And so in doing so, we have to do quite a bit of detailed work with stakeholders and on design in order to look at the options. Accessible streets really needed to understand at a very granular level what that could look like, and we had those conversations with stakeholders, and so we included it in an appendix. I believe that was consistent with our process, and we will continue to work with those stakeholders as we improve that moving forward. So that's why it's in the report.
Okay, so I'll try another one here. So there's another picture of a street, and it has no curbs. So how do the cars keep from crashing? And this is proposed for what's before us. How do the cars keep from crashing into the stores or the people on the sidewalk?
So through the speaker, that is part of the design. The design would propose to include mountable curbs and vehicular unit pavers. Those are the nature of mountable curbs that are used in other locations in the city, including near the St. Lawrence Market, and are used in other cities, both in Ontario, the GTA, and around the world, to make the street more facilitate flexible operations.
Okay, that was your last question. Thank you.
So, Madam Speaker, I mean, respectfully, I probably lost 30 seconds there. And if I may ask one more. Okay,
Councillor Layton, Councillor Holliday, just one fast question because you're way over 5 minutes.
All right. Just back to this map. I just want to be clear on it. Those pedestrian priority areas, would it be correct that these things are about 50 or 60 meters? And would also be correct that although you talk about the street width in the report as being 20 meters wide, in fact, most of the places is actually more than 20 meters wide, especially in front of the Eaton Center, especially near the top here. So I want to get dimensions and scale, correct in councillors' minds.
Okay.
The physical right-of-way, that is city right-of-way of the street in that segment, is 20 meters between Queen and Gerrard. So there is, in some cases at the Eaton Center frontage, for example, there's some privately owned public space, but that is not part of the right-of-way. And in terms of the, just to go back to the diagram of the pedestrian priorities, again, because a flexible street was desired as part of the public consultation process, we needed to really dialogue with the community about potential operations so that we could inform the physical design.
Thank you. Councillor McKelvey.
So my first question is about why is an EA needed for this, and what is the interface with the work that's being done by Toronto Water?
Thank you, Councillor McKelvey. Through the speaker, again, a municipal class environmental assessment is required when a project involves permanent changes to the traffic capacity or future use of a roadway. So that is what is triggering the municipal class EA process in this instance, because the proposed changes would require relocation of the curbs and changing of the drainage. In terms of the Toronto Water work, replacement of the water main is the work that's in the program within the next 5 years because of the age of it. I believe it's 1887 or something to that effect.
So it's 1889. So through this EA, you can decide on the location of the sidewalks, which can then allow Toronto Water to start their detailed designs as well for the waterworks.
That's right. We would bundle this work together. The next stage would be a combined design process on both the underground works with Toronto Water as well as the streetscapes in order to make sure that the location of street trees and the soils that support that's needed for those, location of utilities can all be coordinated for the future vision of that street. The
Okay,
design
thank
of
you.
this type of project takes multiple years to coordinate in order to have that construction time happen.
Correct. Okay, so you're now gonna, once the EA is approved, move through detailed design, there'll be additional public consultation. Would that consultation also start to look out at pedestrian drop-off pickup areas, taxi stands, locations of turning lanes, lay-bys, spaces for tour buses, and all that sort of more detailed type of work? Is that work still going to be consulted upon with the local businesses in the surrounding area?
Absolutely. There would be a stakeholder advisory group restarted for the detailed design process that would include the BIA as well as other major stakeholders along the corridor. And we would consult on placement of trees, curb and paving details, location and timing of an accessible pickup drop-off, all of those elements that you just mentioned.
And likewise, operations as well, as that's a more fulsome consultation as well. Okay, and then my last question is about pedestrians and pedestrians traveling into the area. And how has that changed over time? I mean, I myself, I take the GO train, I walk up along Yonge and throughout. So how have you seen pedestrian movements change in the last 20 years? And how is that anticipated to continue to change going forward?
Thanks, Councillor. So walking in the area has doubled to 24%. And that's both because people are increasingly taking transit into the core from either other parts of the city or regional transit into the core via GO and then walking around, but also because the number of residents who live directly on Yonge Street or in stone's throw distance and use Yonge Street for their day-to-day activities has also increased because we've seen an abundance of residential development that is only expected to continue.
And so the number of pedestrians is expected to continue to grow, but is the number of cars also proportionally expected to grow? Because that's linked with the number of parking spaces, right? So how do you look at the projections going forward?
Projections going forward is that the driving to the study area has decreased by 22% over the last 20 years. And so with people living downtown and working downtown, the ownership of cars has also decreased within that downtown area. More development has continued to be planned.
You're proposing wider sidewalks for the pedestrian safety and the anticipated growth in the future.
That's correct.
Okay, thank you so much for your hard work on this file.
Thank you. Councillor Carroll.
Madam Speaker, just a quick question. There's a lot of pretty forward-thinking design in this EA for the options, even though they are at 30% design. Is there anything in all of those? Are there any features proposed here that aren't already in practice in streets of similar density around the world?
I think the team has been very innovative, but I think we're seeking, we've sought input from best practices elsewhere. I don't think we're breaking the mold where we're trying something that's never been tried before, no.
Right, so there's groundbreaking for Toronto, but not really groundbreaking if we start looking at the globe, particularly the Western world and EU and places like that. Pretty much everything in here rings familiar to major streets elsewhere. Am I right?
All of the physical elements have a precedent elsewhere in the world, yes.
Thank you.
Thank you. Councillor Wong Tam, you'd like to speak?
I would, Madam Speaker, and I do have a quick motion, if the clerks can please put that also on the screen.
Okay, go ahead.
Thank you very much. I'll just quickly describe the motion. The motion is largely to look at opportunities in the interim until we actually get a new street, to perhaps look at expansion for patios and other pedestrian and cycling safety initiatives, and to do so in consultation always with the local community and have the staff report back on those options. The second part of the motion is also to ask staff as part of their ongoing consultations to consider creating a special area bylaw that will allow the BIA as well as other community stakeholders to develop perhaps a new framework on how we can manage the operations of the street, as well as the maintenance of the street with the mindset of trying to further community safety. And I want to thank staff for everything that they've done. And the list is very long. Yesterday, I made a mistake of not writing down the number of people I need to thank, and I'm going to do the same thing today. But truly, this has been an incredible community lift. I'm so incredibly proud of the residents and the businesses who have rallied around this particular project, including, of course, my own staff and the team that's supporting them. But I also want to thank staff. This has been a project that has been years in the making, and under the leadership of Chair McKelvey at the Infrastructure and Environment Committee, we were able to ask some very good questions, but also staff, I think, was able to sort of put to rest some concerns. What we're asking for today is not revolutionary, and the numbers certainly do support that. You have about 100,000 people that march up and down Yonge Street every day. They're just walking and traveling along Yonge Street. If you want to extend that number to what it looks like annually, there's over 36 million people walking north and south on Yonge Street, east and west along the corridor. There's no traffic count that even comes close. This is one of the busiest streets, not just in Canada, but in North America. Some of the busiest subway stations where you can board and deboard happen to take place within our catchment area. And yet the sidewalk infrastructure has been woefully inadequate for years. And I think that this is something that we should lean into. Whenever we dig in Toronto, let's do it all. Like, let us not dig once, patch it up, come back, dig again. Let's make sure that this major construction is coordinated so we can actually bring in the very best infrastructure that is also future-proof and resilient. And that's one of the things I'm very excited about, is that this particular opportunity is not just about how do we reallocate the roadway and allow for vehicle and pedestrian and cycle traveling patterns, but it's also about leaning into the future so we can build a street that's more resilient. If there was going to be a main street for Toronto, a street that we all gravitate to when we have parades, or perhaps the second NBA championship that will come to town, we all come to Yonge Street. And when we are ready for a close-up, when on the cameras of the world are here, we want us to look our very best, because we want that to be our calling card street. So yes, the numbers are there, and we clearly have anywhere from 50 to 75% of the people who travel along Yonge Street are pedestrians, and yet at the same time, they only have 25% of the real estate, which seems grossly unfair. I just think that it's important for all of us to recognize that this is an opportunity, I'd say, that is going to allow us to transform the city. And COVID has been difficult. It is very much heartbreaking for me as a local councillor and as a resident. I can see Yonge Street from my window here. As a resident who actually is seeing my neighbors and the merchants board up their streets. It has been very, very tough on our main streets. And we're going to have a conversation very shortly about small business tax reforms. This is going to be the new Yonge Street, I hope, and I know that we would all want to champion this. I hope that this will be part of our downtown recovery. And downtowns, as I've mentioned before, have taken a particular beating during the COVID recession, because we're so reliant on institutions and workplaces and bank towers all being open, and none of those places are open. Whether it's Ryerson University or perhaps the Central Business District, we're sitting at such a diminished capacity around occupancy. It's very difficult for us to recover. But when we do recover, we want to come back blazing strong. And we want to be able to be a street of choice. And that's what this conversation and this initiative is about how do we repurpose Yonge Street so it is the 21st century street for Toronto. It can be the proud and dynamic Main Street. And I look forward to having the support of council. Thank you very much, Madam Speaker. My clock is
I forgot to, we had a problem with the timer and you were speaking for over a minute before it started. Thank you.
Oh, I see. Thank you very much. Thank you.
Councillor Holiday to speak.
Speaker, no motions, but I want to make some comments. I wonder if Center Table could put up that photo I sent in, or the website. It's just a live view of Yonge Street right now, just to give some context to all of this. So I mean, there's Yonge and Dundas, right? You see people are falling all over each other. And yeah, I know, Counselor, you know, it's the middle of COVID. There's not that many people there. Look, I've either gone to school or worked within a block of Yonge Street for 27 years. I'll match how much shoe leather I've worn on that street to anybody on council. Perhaps Councillor Wong Tam living nearby, maybe he's got one up on me. But for the rest of them, spent a lot of time, frequented businesses there, and I know that stretch very well. Yep, it's 20 meters wide in the right of way, but what's not mentioned is all the extra sidewalk that's being given through all the various developments. If you don't believe me, just go on Google Maps, take a drive up Yonge Street, right, on Street View, and just see what's there. So I've been struggling reading this report, trying to figure out what it is, the problem that we're trying to fix. You know, what are we trying to do with all of this? But even more perplexing is the stuff I heard in the answers to the questions. I mean, the resolution here is that council endorses the recommended design concept of the Yonge Tomorrow. And you read the report here, and like, it's really clear. We've got gates, we've got you know, pedestrian priority areas, which is, in my view, a fancy way of saying, you know, it's closed to cars during the day. In fact, I used to joke around and say, you know, there's some members of council, you know, they would ban cars in the downtown Toronto if they had their ability to do it. Well, I'll tell you, if you look at figure number 8 with a gate, isn't that what we're talking about right now? I mean, nothing says welcome to Toronto like driving up to a gate. So, you know, if I sound a little frustrated with this, I am. I just, you know, I'm searching here for the concrete reason why we want to do this. We're going to be the city that fills in lanes of a street this long. And what is it to achieve? It's to achieve pedestrian priority areas that are like 50 meters in length. Here's the map. And we create a labyrinth for anybody that wants to pass through this section of Yonge Street. Now, the funny thing about those gates is they remind me of bunny rabbits. You start out with 2, you know, at either end, it sounds like a good idea. And like bunny rabbits, they begin to multiply over time. And that's my concern here, is this is the beginning of a significant change downtown. And I'm sure some of my colleagues on council will say, that's fantastic, that's what we're trying to do. But I think this is the beginning of a very big change. And, you know, I want to make sure that downtown remains welcome and open to people, and that the locals go there. You know, when I grew up, we would go to Yonge Street. There were fantastic, cool stores there. I mean, it's changed a lot now. And if you go there, you'll see a lot of the stores we're talking about are big chain stores. And look, I shop there. I go to them. When I'm at City Hall, I sometimes pick up lunch there. I'll pick up different things on Yonge because there's still a variety of those type of places. But, you know, if we make it too much of a touristy area, you know, as the old saying goes, right, about tourist districts is that, you know, the locals don't shop there anymore. It becomes that touristy place. I suppose my frustration in all of this is that the Yonge Street has always been the downtown for us in the city, right? All of us, no matter what part of the city you're in, you had some relationship with there. You go to the theater, you go to the Eaton Center, you go to the different eclectic stores that are along there. And my fear, if we mess it up and we create a labyrinth, people will begin to sense that and feel that. And for reasons, you know, many, they will stop saying it's the downtown for us, but it's the downtown for them. And, you know, I don't want to go there with that. As I said, just trying to look for the thing that we're trying to fix. If it isn't broke, don't fix it. And, you know, if you don't believe me on this, I mean, just go on to the Google Street View and just take a ride up a virtual drive and just look to see what you see on the sidewalk, the numbers of people, the spaces, the types of stores there, and envision this change and ask yourself why we're doing it. Thank you.
Thank you. Deputy Mayor Minnan-Wong.
Yes, thank you, Madam Chair. I won't be supporting this. Oh, there's an echo in there. Is there an echo?
Yeah, there is an echo. Now you're fading.
How about now?
Okay, yes, you're okay
Is
now.
that better?
Yes.
Yeah, Madam Chair, I won't be supporting this initiative. I think Councillor Holladay used the analogy, if it ain't broke, don't fix it. It's broke. We're breaking it even more if you look at the downtown. You look at the congestion in the downtown, what it was pre-COVID. And you look at what we're doing, we're making it even worse. You look at where we've restricted lane traffic and we've made it harder to travel downtown. There's King Street, there's University, there's Bloor, there's Wellesley, there's Richmond, there's Adelaide. We've got a congestion problem in this city. The downtown belongs to everybody, to all Torontonians. Yonge Street belongs to the entire city. And we are making it worse to drive in this city. It's about balance. We don't have that balance anymore. We are discouraging people from traveling downtown. And I listened to the deputations quite carefully. And one of our most important tenants in the city, Cadillac Fairview, for one of probably the anchor tenant, retail anchor on Yonge Street, Cadillac Fairview in the Eaton Center, said this is a bad idea. I agree with them. I don't believe in taking out 2 lanes of traffic on Yonge Street. We also heard from small businesses who disagreed with that as well on Yonge Street. But I think we should be encouraging people downtown. One day, and hopefully soon, this pandemic will be over and our streets will be full again. And we'll be making it harder to drive in this city. And I disagree with this. And this isn't the first step. Believe you me, I think that if we do this part of Yonge Street, the local councillor will come and will be looking to do the rest of Yonge Street. And I disagree with that too. So I think this is a bad idea, and I will not be supporting the recommendations in the report. Thank you, Madam Chair.
Thank you. Councillor Bradford. Councillor Bradford?
Yep. Okay. Thank you, Madam Speaker. Appreciate all the comments and discussion so far. I'm just weighing in here to express my strong support for Young Tomorrow. And, kind of reflecting on some of the changes that we've seen over the past year and thinking about the deep involvement that went into the new design and implementation of Destination Danforth this summer with Councillor Fletcher. I can speak from direct experience that this kind of change truly is transformational. Let's keep in mind that our streets are in fact our largest and most extensive network of public space. And when we make them safer for people, when we make them more vibrant, when we make them better for local business, and when we encourage active transportation, we get a better result. 6 months ago, Danforth really looked like an arterial highway. It was frankly like being in a different world where transportation decisions were based on different factors, where thinking about retail was informed by different assumptions. But we've moved beyond the antiquated engineering philosophy that's solely focused on how we could move as many single occupancy vehicles as quickly as possible. I think that's a good thing. As the previous councillor suggested that we are making it worse to drive in Toronto. I guess it depends on who you ask, but I would say we are making it better to live in this city. And that's what this is about. What we saw in Danforth this summer was a vision that many folks have held for more than 40 years. Everyone knows it's not a simple motion that gets that stuff done. It's a lot of hard work. It's a lot of consultation. It's about building coalitions of support. And Councillor Wong Tam has certainly done that here. This is something that's been in the works, as I understand, for more than a decade. And it takes time, but we have to maintain our resolve and our focus on building a 21st century city for people, creating an environment that first and foremost supports safety, of course, but also supports local business and attracts investments. And I think we're seeing that with good design and good consultation and a willingness to iterate, listen to that feedback and experiment, we can actually achieve a lot of things all at once. So there's no question that this stretch of Yonge Street is already iconic in many respects. For those of us who live here or who visit, it's definitely one of the first sort of streetscapes that comes to mind when you're thinking about Toronto or the big city. I grew up in Hamilton, as some of you know, and remember coming into the city, and this was a place that you wanted to be. Coming in for a Jays game, maybe we'd go up and visit the Hard Rock Cafe, rest in peace, shopping at the Eaton Center. Back when I had hair, I used to get my hair cut at House of Lords. That was always a bit of a trip up there. I know it's a little bit further north, but this is a place that's experienced a lot of change. And 2 decades ago, transforming Yonge and Dundas, that was very controversial, right? But it was seminal, and it's become iconic in its own right. And Yonge tomorrow promises to be another brave and bold move for this city. So I think it's about safety on our roads. I think it's about bringing people back to our downtown, as Councillor Wong-Tam articulated, celebrating the core and improving one of Toronto's oldest retail and service destinations. This project is definitely going to do that. And bringing this project forward across multiple wards takes a lot of collaboration and patience and deep engagement. We've heard about that work, and I think that's ultimately why we're going to have a positive impact on Yonge Street. It'll be fantastic for that neighborhood, but it will also be fantastic for Toronto. This will be a marquee destination for everyone. And as this rolls out and it builds out over the next couple of years, I think it will become such an essential fabric and piece of the core that we will have a hard time remembering what it was like before. So I'd like to conclude just by acknowledging the hard work and leadership of Councillor Wong-Tam and Cressy and Layton, as well as Mayor Tory, and all the fantastic staff that have put in the long hours and work to make this happen. Appreciate your commitment, and looking forward to seeing this move forward. Thank you, Madam Speaker.
Thank you. Before we go to the next speaker, to members of council, I would like to have this item completed before we break tonight. Councillor Pasternak to speak.
Thank you, Madam Speaker. I have a motion. And all it is some guidelines for future consultation. It is making sure that when it comes to pedestrian drop-offs and pickup areas, and taxi stands, that those are taken into consideration. The locations of the turning lanes and lay-bys, and of course the possibility of spaces for tour buses on Victoria Street. Fairly motherhood, fairly basic, and I realize there is a lot to do. It's hard for me to be not supportive of this after I had such support on the last item, which was very important to the city and to Ward 6. But I'm reading some of the correspondence here of the the downtown Yonge BIA and Cadillac Fairview, and there is really a deep concern that they can operate effectively and save the businesses around that area with this plan. So I'm hoping, I understand that this will come back with an operational plan and other iterations. So I wait on the further consultation. I wait to get some positive response from the business community. I'll admit one of these letters is a bit on the old side. It's from September. The other one is fairly recent. It's less than a month old, or a month old. And it just makes me pause, because I know many small business owners are suffering at this time, and I don't think government should do anything to hurt them. Now, that being said, I cycle. We brought bike lanes to Ward 6, to York Center. We brought bike share to York Center, and it's been extremely successful and popular. And I know I've mentioned a few times before, but 10 years ago when I ran for the first time, you couldn't mention bike lanes or cycling in the area I represent. And there's been a change. There's a great acceptance to micro-mobility, to exercise, and to cycling. And if it wasn't so cold out these days, I'd be still out there. So with that, I wanted to thank staff for their work on this, because I know it was a lot of work and it's many years in the making, and to thank the local councillor. But at this time, I'm concerned about the health of our economy, the health of small business, and want to see the next iteration before lending my support. Thank you very much.
Thank you. Councillor Carroll to speak.
Madam Speaker, it's almost cruel to mention this when we've all, it's none of us has left this country since 2019. But, I was very lucky a number of years ago Walk 21 was hosted in the city of Den Haag, The Hague. And Mayor Miller, on his way out, was during his lame duck phase. He recommended that Councillor Adam Vaughan and myself go because the agenda was completely urban suburban, and the two types of agendas with respect to movement, pedestrianism, transportation, tourism, and economic development in the context of transportation. He said, you got to do this because this is the agenda of this city for the next decade. And so we went, and I well remember standing on the busiest street in that city, which emanates from City Hall and proceeds down the most business-oriented, tourism business-oriented street in the city, filled with hotels. And it was carless. Yes, it was carless. Some of my colleagues have expressed despair about that. It had bollards that disappear into the street. And Councillor Vaughan, at the time, Councillor Vaughan, was kind of freaked out by all of this because we were discussing carlessness at TIFF in his ward, and he thought, how can this ever happen? And sure enough, because it is The Hague, a dignitary in a limousine and his whole posse, about 4 cars behind him, came along to the major street. And while we were standing right there, down went the bollards, and the whole contingent of cars headed into that main street, whose subway was visible right in the middle of the road under glass brick. And that whole contingent of limousines headed right into that avenue and dropped those dignitaries at their hotels. And the pedestrians flowed out of the way because while they are prioritized, that community got used to the fact that this is an important street, and occasionally vehicles will be there, bicycles will always be there. The bollards will make sure that we all share and signify to us it's time to adjust to let these people in. It was a miraculous thing to see. And people say, oh, that's a little Dutch town. It's a little Dutch town of 2.2 million people. And the people downtown are happy to come downtown and use that street and all its bars and all its hotels, and even visit the city hall, which itself had an interesting design, because they knew they would be safe there. And so they frequented the businesses. You go up and down Yonge Street right now, what you'll see is a lot of boarded up businesses. And this has the potential to bring it back. And when we talk about businesses, let's talk about a business that is internationally known in Toronto and actually has had the experience of using carlessness to drive its business, to build its business and become even more popular the world over. And I'm talking about TIFF. There were a lot of deputants who are in business at executive worried about this, but I want to take you back to the correspondence that came from Cameron Bailey at TIFF, who's had the experience of driving business by approaching modern forms of street usage. At TIFF, every September, the world comes to Toronto to see the best of Canadian international cinema. And part of what makes this possible is showcasing transformative films at the Elgin and Winter Garden. For decades, this historic site has played a significant role in our ability to attract tourists and talent. Downtown Yonge Street is a neighborhood's backyard and a country's main street. Young tomorrow needs to cater to both. And this proposal addresses the hyperlocal needs of a community while strengthening the long-term economic development and success of our whole city. We at TIFF urge to support this once-in-a-lifetime opportunity to amplify Yonge Street's prominence as a vibrant pedestrian prioritized, globally significant, and flexible destination street can be. I can't say it any better than Cameron Bailey, Madam Speaker. Those are my comments.
Thank you. Councillor Fillion. Okay, members, we'd like to finish this item before 6. Councillor Fillion?
I'll be quick just for you, Madam Speaker. So, you know, there are people who see the future as a scary place, and if you try to introduce them to change, they react as if you were shoving them into a dark room with no light switch. I don't see future as an opportune place to go. And change is not only inevitable, but a great opportunity. And I'm so glad that this term of council, we have a predominant people like Councillor Wong Tam, but also, you know, many others who really are forward thinking. And we have made great strides this term. And, you know, who would have thought it in the middle of a pandemic? But, you know, I'm just so thrilled with the way this council is embracing change and moving ahead really successfully. And, you know, 20 years from now, people will find it almost unimaginable that there was opposition to this kind of change. The same as, you know, it probably seems incomprehensible to most people that there was once a very strong group who were, you know, trying to keep smoking in bars and restaurants and saying, you know, everything was going to fall apart if we ever changed that.
Councillor Fillion, we can't hear you. We're having problems. Do you want to shut off your video? Councillor Fillion. Okay, we lost him. Okay. Okay. To 2.5 minutes. Okay. Yeah. Councillor Grimes to speak. Councillor Grimes?
Thank you, Madam Speaker, and it's unfortunate the people in Ward 18 are still on dial-up. I feel bad for John Fillion there. We should maybe put some money into getting high-speed internet Ward 18. But just listen to Councillor Holiday talk. I remember being a kid and driving up when people came in.
And of course, nobody would imagine it.
Oh, is he there?
Oh.
Am I on?
Yes, you're on. Councillor Fillion, we put you on hold for now. Councillor Grimes, continue.
You want to put me on hold or keep going?
No, you can continue. We'll put Councillor Fillion on hold.
Madam Speaker?
Yes, Councillor Grimes, please continue.
Guess I'm on dial-up. Can you guys hear me?
Yes, yes. Councillor Grimes, continue. Councillor Grimes, are you there?
Keep going, Mark. I think we lost the
Madam Speaker?
Yes, I hear you. Can you speak?
Okay. Well,
Hello?
that's good.
Hello? Oh,
Am I on? Can you guys hear me? Gordon, can you hear me? All right, good. So just listen to Councillor Holly talk about, you know, growing up and going down that street on Yonge Street. I remember when people came in from out of town, the first thing we did would put them in a car and we drive them all up, you know, Yonge Street, the longest street in the world. And we put them in the car and drive up, and back then it was pretty crazy times, and it's still a really cool street for our city. So, you know, I have some concerns, as Councillor Holly said, but also Councillor Pasternak. I drove up there the other day to look at it, going from 4 lanes down to 2, but I love what Kyle Ray did at the Dundas Square, how all the signage reminds of mini Times Square there, but it's fabulous what's happened there. But, you know, I looked at it saying this going down from 4 to 2. I think we can take the 4 to 2. I saw that original plan where it had one way going this way, one going that way. There's no way it would support that, but I think I can support this thing going down to 2 lanes. I do have concerns, which I understand will be addressed later on, how, you know, people will stop and have deliveries happen there. You see all the Uber Eats that's happening now. How would they stop and pick up? And I have concerns there. But I drove up there the other day and I thought, you know what, this could probably go down to 2. I remember Denzel Minawong when we had the scramble intersection happening at when he was the chair of Public Works, and you know we had that scramble intersection at Dundas, and it was like, oh, the end of the world was coming. But I stopped there the other day. There's so much happening in that area. It was great to stop at the light there and see all the stuff happening on that corner. It was kind of a pleasure to stop and see what was happening here. But you know, I drove that street the other day and thought, you know what, this could probably go down to the 2 lanes. I would support that, but any other, you know, putting one way this way, one way that way, I would not support it. I think it's a great street. I think a lot of people still they want to go to Yonge Street when they come to the city and drive that long drive all up to the 401 and back down, which I do quite regularly. Even in the summer, we bring people in to show it to them. So I will be supporting it. I do have some concerns, but I did go look at it, and I'll be supporting what's before us at this point. Thank you.
Thank you. So, Councillor Fillion, are you back on?
I think so, and I think I'm not sure where I cut out, but I think I was
You have
close to wrapping up.
yes, you have 2.5 minutes, so if you'd like to continue.
Well, sure, but I won't fill them for the sake of filling them. You know, I think this is a great thing. I think we're doing great things this term, and in the future, people will look back on this term as a time when council really moved forward, and you know, there will be nobody who wants to take any of it back, as I was saying, any more than anyone would want to put smoking back in bars and restaurants, which, believe it or not, was a very controversial item years ago. Thank you.
Thank you. Councillor Ainsley to speak.
Thank you, Madam Speaker. I don't have a motion to move. I just want to say that I'm fully supportive of this report and the work that's been done here. When I first started looking at this report, it brought me back to driving through Times Square, different stores and things to look at. All I did was look straight ahead because I was worried about it, either hitting a pedestrian or a car. A few years ago, we were in New York City. Times Square has completely changed. You can't drive through it. It's all pedestrian. It's very vibrant. I know people in New York City had concerns about shutting cars and vehicles out of Times Square and what it was going to do to deliveries. Well, none of those fears came to fruition. And I look at the Yonge Dundas area in a similar way. I don't drive through there a lot anymore. It's very busy, both pedestrian and motor vehicle. You know, there's so much to look at. You know, similar to Councillor Grimes, we brought people through there from out of town to look at it because there's so much going on. It's so vibrant. Nothing like when I was a kid, when there was just music shops and, you know, not a lot to do, not a lot of people. I think it's changed a lot. You know, Councillor Holiday referred to, you know, if this goes through, it could be like bunnies, and it'll be happening all over the city. Well, I hope it does happen all over the city. You know, once again, I refer to New York City. When Times Square was redone, staff were given the power to do it. They put patios and changed street corners, more pedestrian friendly. I actually feel sorry for Barbara Gray and our transportation staff, because every time they want to do something like that here in the city, they have to come to city council and get our approval. New York City was done under delegated authority. If it was left to the politicians, it probably would have never been done. So I look forward to this. I look forward to the transformation. I look forward to this project moving forward, and hopefully, like bunnies, we'll see similar projects to this in other areas of the city. Thank you, Madam Speaker.
Thank you. Councillor Robinson to speak.
Thank you, Madam Speaker. Certainly would like to support some of these concepts. As many of you know, I founded the Celebrate Toronto Street Festival, which was a mega city event post amalgamation under the I guess the council at the time and the mayor at the time, who was Mel Lossman. So certainly a fan of pedestrian malls, temporary closures to celebrate our city, our neighborhoods, our communities. You know, get emerging musicians out on the street, fruit markets, farmers markets, etc. I just feel that there's lack of clarity around some of the issues, and so while some of the concepts are great, I too worry about making sure there's substantial pedestrian benefits to this endeavor, and I certainly hope there are. I'm also concerned because I've been told twice now by staff that the gates and the bollards it's not clear how they're using those yet, but yet on page 25 of the report, it says the gates are recommended in either end of the pedestrian priority zones, closed during the day 6 a.m. to 1 a.m. and open overnight 1 a.m. to 6 a.m. to allow bus access, general traffic. So I'm just, Madam Speaker, I'm just not clear on what the gates and bullards and whether they're a flexible temporary use for festivals, events, sidewalk sales, what have you, or whether they're going to be used in some permanent fashion. So I guess that's a wait and see, although I wish we knew today what that was happening with that. I'm also concerned about the Eaton Center and their concerns around this. They play, you know, they've been an iconic institution in our city, and we need to work with them. So, you know, and I like to hear Mark Grimes, Councillor Grimes, talk about Yonge Dundas Square, all the work that went into that many years ago, getting that site up and running. Bobby Schneiderman and many others. It's pretty dynamic space, and this seems to align with that. But I am struggling with some of these finer details that have not been ironed out. And I guess I want to make sure, I want to feel confident that it's not a permanent, they're not going to be used, the gates and bullards, for permanent closures. But as staff verbally said during the Q&As, they're going to be used for temporary closures, for flexible closures. So I'm just not clear on that piece. And I wish I was, because the report says I feel something otherwise. So that's the piece I'm struggling with. I have been up and down that street multiple times, as we all have. I think it's basically 2 lanes now with all the hubbub and activity going on. It kind of feels like it's already 2 lanes in that particular stretch. So I don't know if we're going to there's a huge loss here in the other 2 lanes, but I do wish there's a way we could better communicate these initiatives to the general public, because I feel people are not aware of some of the things we're doing here at City Council. It's hard to be engaged when you're battling a global pandemic. And while these initiatives are great for COVID, they're going to be permanent initiatives. And I just wish there's a better way we could communicate more effectively to the general public these types of initiatives, so they can weigh in. I know there's been public meetings, etc., but Yonge Street is it's iconic, as we've heard before. It's the longest street in the world. It's something to be celebrated, and we all feel like I certainly, border it. Councillor Cole borders it. Many of us border it, but I think the whole city feels like they have a piece of Yonge Street. We all own it. We're all proud of that amazing street. And, I just wish there was a better way to communicate to everybody the things that are happening here or being proposed here, because I just don't think the general public outside of the downtown core know this is being proposed.
Thank you.
That's it.
Councillor Bylaw to speak.
Thank you, Madam Speaker. I was listening to some of my colleagues talking about when they were teenagers and went to Yonge Street. So I wasn't even going to speak, but then I started remembering when I was a teenager and arrived in Toronto and some of my observations. And I think I want to share a couple of them with you. One was the lack of patios. Obviously, as a teenager coming from Europe, I looked at Toronto and was like, there's not enough patios in this city. And look at us now. If Cafe Tio is any indication, God forbid we were going to now not have as many patios as we have in the city. No, it's something that Torontonians love and enjoy. The other thing was a Carla Street. I went to Yonge Street and thought it was a pretty cool street, but I was coming from a place where, major cities have this very robust commercial street in the middle of the city where pedestrians come along and enjoy the street and the public space. And there's lots of activity, art on the street, events, and I thought it was strange that we didn't have something like that in Toronto. And so now I'm scratching my head, and it's like, oh boy, it took us, it's taking us a long time to get to something like this. So I think as Councillor Fillion was saying, let's not be afraid of the future. The city is growing. We want lots of teenagers, lots of people to be able to come to Yonge Street in a safe way, be able to enjoy Yonge Street, be able to walk on that street, be able to shop on those stores. I agree. It's an iconic street. We all love to go to Yonge Street, but we need to create the space and the infrastructure so people can do it in a safe way. And I think that's what we're trying to do here. And I think in the middle of a pandemic, with the pressures that downtown is having, I think this can be a great recovery strategy. Actually, I think these kinds of projects are exciting as a recovery strategy, to work with the BIAs, to work with the business on this as a recovery strategy for the downtown. These are the projects that we need. So I'm excited to support the project. I want to thank lots of people that have been involved, local councillor, our staff, for all the work and advocacy that they've been doing, and I'm looking forward to seeing it moving forward.
Thank you. Okay, Councillor Perks.
Thank you, Speaker. Congratulations to Councillor Wong Tam and to the city staff. It's gorgeous. I can't wait. You know, I went through something like this when we redid Roncesvalles and took a whole lot of the parking out and narrowed it and made it more bike, transit, and pedestrian friendly. And there were angry people and angry public meetings. How dare you, how dare you, how dare you? Until it was finished, and until the New York Times had actually described Roncesvalles as the most delightful pedestrian stroll in Canada. And actually, my only worry with this is that this section of Yonge is going to overtake Roncesvalles and be even more successful. So congratulations to all of you. Don't get fussed at the noisy death rattle of Autosaurus. You hear it all the time. It'll fade. Thank you.
Thank you. Councillor Layton. Councillor Layton.
Can you hear me?
Yes, I can hear you.
Just to confirm. Okay, thank you very much, Madam Speaker. I just wanted to speak in support of the recommendations coming forward from Council. And if you're like me, you've been to these other cities around the world and you've walked down those streets. In fact, I've actually walked down some of those streets with other members of Council, with Councillor McKelvey, Councillor Crawford, and we've experienced what the individuals in those cities get to experience on a regular basis. It's a different speed, it's a different feeling. And you know, if you're like me, you say, why can't we have that in Toronto? And or if you've only seen this in pictures and you say, you know, what a beautiful scene. If only we couldn't have that in our community. And then you think about all the work that it would take. And many of you, we probably know it more than the average citizen about the amount of work it takes to actually achieve something like this. And it doesn't happen overnight. It happens over a course of, in some cases, many years, where we go out and consult the public. And when elected officials are brave enough to get past that first line of objection, that line is, let's protect the status quo. Any change is bad. Once those community members, those elected officials are willing to step past that, that's when you start to see those true and fundamental shifts in how our cities work to be more reflective of those in other cities. Big and small around the world have tried this. We're not treading any new ground in the global context. This is us simply following what is a very well established norm all around the world. And why are we doing it? Well, we're doing it because there's tens of thousands more people that live around Yonge Street than they did 50 years ago. There's 100,000 people that walk on Yonge Street on a regular basis, on a daily basis. We're also doing this because it lives up to all of our other major city plans that the mayor and other councillors probably go to their communities and tout. Vision Zero. This is about protecting people. people that travel through our community in far greater numbers than those in cars. This is about Transform PO, us living up to our local and city's obligation, but more importantly, our international obligation to fight climate change. You know, we have a city webpage on the Toronto Public Health webpage simply on the health benefits of walking. Why wouldn't we put any more money to that? Our tree canopy goals. This will provide more space to put trees in our city in the downtown core. You know, these are positive things that we've all agreed upon. And if we're not willing to take the steps to do that in a fundamental way, what I believe here to be a very fundamental way, although we're only voting on a small piece of it today and right now, I hope that this leads to more of this kind of thinking. And it's hard work because it's tough to get past what Councillor Perks, I can't remember what he called it, but he called it something fun. It's hard to get past folks that just want to stand for the status quo. Because it'd be really easy for us to do nothing with our time here. Well, I don't know about all of you, but I came here to make a change in the city and to make a change in my community. And this is part of it. I'd like to just thank the staff that have been involved in this for showing their bravery, their honesty in front of 2 deputy mayors, in fact, speaking out against this report. And finally, I'd just like to thank Councillor Wong Tam because she's been carrying this baton for 10 years. And anyone who thinks that notice hasn't been given to the whole city and the members of this community and surrounding area, they're dead wrong. This has gone through countless public meetings. It's been a good process. Let's take it the next step further. We can continue a dialogue around the operations of the site, which I hope will get even stronger to provide for some of the benefits that we're talking about in the report. Thank you very much. Thank you, Councillor Wong Tam.
Thank you. Councillor Ford? Councillor Ford?
Well, yep. Can you hear me?
Yes.
Excellent. All right. Well, Madam Speaker, in the interest of time, I will be brief. You know, I'm having a hard time with this one because, reading the report and the concept of making Yonge Street, a pedestrian promenade, or how I could say it's more, pedestrian friendly and more cyclist friendly is a great idea. It really is. And I think even going further than what this report is recommending has some merit to it. And making a fully pedestrian promenade. I think Yonge Street, when you get right down into the downtown core, is a major street in our city, but it's also a very local street. The challenge is, and it probably won't be a surprise to many of my colleagues, I won't be supporting it though, because the challenges I have, like colleagues who spoke before me, Councillor Holiday, or Deputy Mayor Holiday and Deputy Mayor Minden Wong, it's how we have approached city planning around continuously constricting traffic in the downtown. And we live in a reality out in the suburbs and beyond the city of Toronto where people drive, and they have to. And we look at people coming into the downtown, our population raises by millions in the day. And I just think we're further and further and further constricting that. But to the plan itself, looking at the plan specifically, I think it's great. And in the broader context of our downtown and the vitality of our downtown and the people who travel into the city, with that in mind and knowing that this won't be the last project, Councillor Layden just said that before me, around he hopes there's much more of this. And that's my concern. So with that being said, I won't be supporting this. Thank you.
Thank you. Councillor McKelvey to speak.
Thank you, Madam Speaker. I'd like to start by recognizing Councillor Wong Tam and city staff for all their hard work on this file. I know they have had many conversations with residents and businesses. And importantly, as you can see from the motions, they've also committed to continuing in those discussions. There is some confusion in what we approve here. So I just want to remind people there is a supplemental report that was developed by staff that outlines it very clearly. What we are deciding upon today is what needs to be submitted for the environmental assessment. And that's looking at the 30% design, the location of the sidewalks, the number of lanes. The next steps will involve extensive consultation, and in that respect, I am supportive of both motions by Councillor Pasternak as well as Councillor Wong-Tam that will look at extensive consultations around detailed design and, importantly, operations, which I know a lot of people have touched on today and stressed they have had some concerns on that. But we have a really unique opportunity here. Toronto Water has to upgrade a water main from 1889. That is an incredibly old piece of water infrastructure that I personally can't wait to see what that looks like when it comes out of the ground, because I think there could be some interesting corrosion studies done on that, just scientifically speaking. But it also gives us the opportunity to widen the sidewalks and improve the pedestrian realm. And that is important for our future. You've heard that people are now coming in from multiple modes of transit into the downtown core. The one that comes to mind to me as something that's going to increase dramatically is GO Transit. They've switched to 15-minute service. They're electrifying those lines. There are going to be even more people coming in from the surrounding area. In addition, there's huge development pressures. There's lots of buildings that are being built there, so that's going to bring in more pedestrians. So the number of cars coming into the area can't increase to the same extent because it's limited by the amount of parking that is in the downtown area. And of course, that is very limited. And we've seen over the years that it hasn't increased to the same rate that a number of pedestrians have. So for these reasons, I am fully supportive of this report. I'm very excited about the next steps that are before us, those consultations that will happen around detailed design and operations. I hope that everybody gives some serious consideration to supporting this so that we can submit this environmental assessment and get on with this important detailed design work. Thank you.
Thank you. Councillor Thompson to speak.
Much, Madam Speaker. I just wanted to lend my voice to this issue. First and foremost, let me congratulate the local councillor on the work that she has done in collaboration with the community and certainly to city staff. I spent some time to read this item thoroughly on the weekend, Speaker, and also I have spoken with several of the community groups and organizations in this area. And it seems to me, certainly, that as part of what has just been stated by the chair, Councillor McKelvey of the committee, that, look, this is an environmental process that we are going to go through and so on. But this goes back, I mean, there's a tremendous amount of consultation, and I actually looked at it and looking at the streetscape, and I know that Councillor Robinson talked about Celebrate Young and certainly the creation of that and so on. And I think it's really important to recognize the extensive nature of work that's gone in. Let me also say to you, Madam Speaker, that when I first moved to this country, which was in the 70s, Yonge Street, actually from College Street to Queen Street, was basically a car-free area. I don't know if it was only on the weekends, because I was probably about 12 or 13 years old at the time, didn't pay a lot of attention to it. But what I do know and do recall was that my mother and my uncles and other relatives, we enjoyed going to Yonge Street. I think we had one car in the family at that particular point in time. We would walk along and really enjoy it. This is an area that I think has the potential to be, as the local councillors is demonstrating, to be all that it can be and to realize its potential to be this great place, piazzas and extensive sidewalks and so on, and that will engage and bring more people into this particular area. I also want to remind everyone that maybe not in my lifetime, maybe not in most of our lifetime, I think maybe in Councillor Cressy's lifetime, you'll have basically autonomous vehicles traveling in this area. And so we won't really worried about, we won't be worrying about people parking. People will be moving, getting into a vehicle and getting out of the vehicle. The vehicle will pick someone else and so on. So be constant motion and so on. And so as we look in terms of how we can create a more livable environment and create more opportunities and so on. And I do think from a business and economic development perspective, I do think that this will be great for this area. It becomes an iconic environment for people. And so I want to basically lend my support to this. Obviously, there's a long way to go. And so this is part of the process. And I think that we should give this the green light. And again, congratulations to the local council and her tireless work in this area, along with members of the community. Thank you, Speaker.
Thank you. I just want to make a few comments since we're going down memory lane. I don't know how many councillors remember the 60s. Well,
know how old Councillor Thompson is.
In 1967, 66, I worked at King and Young, and I remember Yonge Street being closed when I was working at a brokerage at King and Young, from Yonge Street to Dundas. Every summer, Yonge Street was closed, and it opened up, and there were festivals, restaurants, people walking. So I'm going back to the 60s. So I don't want to tell anybody my age, but that's memory lane for you. Mayor Tory to speak.
Speaker, thank you very much. And I want to begin, as I tried to do, and I know we all do, to thank the staff for their hard work on this. This is one of those files that's, as they all are, they're all complicated, and there is no sort of right answer that satisfies everybody, and you have to achieve a balance, and I'll come back to that in my brief remarks. But I want to thank them for their hard work, Jacqueline Hayward, and of course Barb, and all of the team in transportation, and everybody else that's been involved from different departments of the government. You know, one of the other bits of good news that gets lost in all this, and the reason that we're sitting here having to make this preliminary determination today, is because we're finally getting on with the work across the city of replacing some of these 145-year-old water mains and other kinds of infrastructure like that. It's not very glamorous work. We invested a lot of money in it the last number of years, getting on with work that we postponed doing. That's going to make a positive difference given the development and the population and the business that's going on up and down Yonge Street, even the size of Ryerson, which of course is just an extraordinary success story. And it's an extraordinary success story for populations, you know, largely within the city of Toronto, though they do attract their share of international students as well. You know, I would say the same thing of this and where it ends up, because the work is just beginning on the detailed design and operational plans, that we should be making sure not to take something and declare it adequate, which probably is the way you describe Yonge Street today. You know, it is widely acknowledged in some senses in a mythical way as the kind of main street for all of Canada. Most of the people outside Toronto would disagree with that, anything that was main in Toronto, but it's seen as the main street of Canada, but you'd have to describe it in that regard as just adequate. And I think we have to make it not just good, which is better than adequate, we've got to make it extraordinary. And I think it's got to be something that's extraordinary and stands the test of time in the context of, you know, of where the city's going to be in 50 years. And it has to take account, yes, of changing habits that people have, of changing mobility patterns. And it has to meet the needs of the people who use it. And that is a range of people. And it does include people in cars and trucks delivering things, and transit vehicles sometimes that are on the surface. But it also includes a lot of people who are walking around and enjoying themselves and shopping in different ways. And of course, it includes the need, and must include the needs of business and the needs of a place like Ryerson. And I'll add one more to that. I always would prefer to see these things done in kind of a comprehensive way. I think we need to take a look at Yonge Dundas Square. I don't think that is living up to the potential that people saw for it many years ago, before many of us were here when it was established. And I think we should take a look at that and sort of decide how that can fit within a revitalized Yonge Street. So that's going to require a lot of consultation as we go forward with this operational design and the design itself. A lot of consultation and a lot of balance. Again, I will think that while the extraordinary part refers to sort of how it feels and how you can experience it when it's done, the new Yonge Street, it's also going to end up being something, if we've achieved balance, that is neither going to be 100% of what I'll call them the zealots on either side want. The zealots who would say, you know, none of this and all of that, and the same at the other end. You know, the solutions that we're looking for these days don't call for that kind of an answer to say it's all or nothing, because nothing is all or nothing in terms of the choices we have to make as a city. And so I just hope that we can go forward. I'll just finish with a story. When I went up to the Danforth, when we initiated the bike lanes and the Cafe TO programs up there, especially the bike lanes, though, I sat down with some of the senior business people up there, and they told me that by July 1st, the whole place would be a wasteland. Everything would be closed. Everybody would have gone out of business. There'd be tumbleweed rolling down the street, and the whole place would be a disaster area. And when I went back a month later and sat with some of the very same people, they had to concede that it was a magnet for people, that it drew new life to that place. And that place was lively before, but now it drew new life to it. And we learned lessons from that we're going to repeat and improve upon this year and have more of that. And I don't find any of those people calling me up when they see that we're considering the Cafe TO program and say, please don't do that. The tumbleweed is still coming to the Danforth. And I think the work we're going to do, as long as we keep our balance and keep searching for something extraordinary, will produce the same result. It will be something that's extraordinary and that turns Yonge Street into an even more of a people place and really does keep it as what we would like to consider it here, which is the main street of not just Toronto, but all of Canada. And so in that sense, I look forward to that work, and I look forward to working collaboratively with all the players to make sure we achieve that result. Thank you, Speaker.
Thank you. Okay, so if we can put the motions on the screen. Motion by Councillor Wong Tam.
Speaker, on all the items, please.
Pardon?
This is fine. Recorded vote request.
Okay, recorded vote.
Thank you.
Councillor Fillion, how are you voting? Sorry, Councillor Fillion, I didn't hear that. May I please have your vote?
In favor?
Thank you. And Councillor Carroll?
Councillor Carroll in favor. Yeah, Councillor Carroll in favor. I didn't get the vote either. Thanks.
Thank you.
Councillor Mantis in favor.
Okay. Madam Speaker, the vote.
Speaker?
The motion carries. The vote is 24-2. However, what we're about to display does not include Councillor Mantis, who we just heard at the last minute, so the result will be corrected online. The result is 24-2.
Okay, so you'll record Councillor Mantis. Okay. Yes, Councillor Lai, did you say something? I can't hear you.
Madam Speaker, it's fine, it's fine. Okay, no problem.
Okay, the next motion by Councillor Pasternak. Recorded vote.
Councillor Mantis?
In favor?
Councillor Carroll in the affirmative as well.
Thank you.
Oh, sorry.
The motion carries. The vote is 25-1.
Okay. Next motion. Item as amended, recorded vote.
Councillor Carroll in the affirmative.
Thank you.
Councillor Mantis in the affirmative.
Thank you.
The item as amended carries. The vote is 21-5.
Members of council, do we have any quick releases before we recess? Oh, and we do have a motion to add a member's motion on. We'll do that. That's Councillor Pasternak. You have a motion that you want to introduce?
Thank you, Madam Speaker. This is an urgent matter as it regards a variance to a development on Wilson Avenue. And unless we deal with it here, I think the project will stop, delaying affordable housing units, the creation of a park, and the creation for, I guess, market condominiums.
Okay, thank you. All in favor? Show of hands. Carried. Do we have any quick releases?
Speaker.
Who's speaking?
Oh, hang on.
Councillor Fletcher. Sorry, Councillor Fletcher?
Yes, it's,
Yes, Councillor
I
Fletcher?
just wonder, Councillor Robinson, are you planning to release that member's motion that you held with your amendment?
Yes, I'd be happy to.
Okay.
The motion was shown formally to council. It's friendly amendment.
Okay, hold on. Please tell me what item it is. MM 2817?
Correct.
Okay, so what's the amendment?
The amendment was shown earlier. The clerks have it to include the park neighborhood.
Okay, hold on. It's not a quick item because I believe that Deputy Mayor Minna Wong wanted to hold the item down.
No, he wanted to move an amendment, which he hasn't done yet.
Show us the amendment, please.
To the clerk.
We need to see it.
Well, I'm sorry, I have to give it to the clerk. I can't give it to you, Mike.
But what about us?
Okay, come on, let's
Take it up with the clerk.
because it's been a long day.
Show us
We
your
just have a
amendment.
few more minutes and okay, do we have this amendment
I'll
ready?
show you
If
mine
not-
if you show me yours.
Okay, let's not show anybody anything, okay? Forget
Sorry,
it.
can I say I don't really want to see it? Is that okay? But
Okay.
on that motion, Councillor.
I don't want to scare you, Paula.
Thanks, Renzo. I like the tie, but we'll leave it there. 28.17 that Councillor Robinson had, both of the motions have now been tabled, so that one's ready.
Okay,
Right?
hold on. I'm sorry, we have to continue holding this item down.
Why?
Because it's not ready.
All the motions are there, Speaker.
It's not.
They're all there.
Councillor Fletcher, it's not. It's not.
Okay, then I'll go to the other one, which is,
Okay, Deputy Mayor Minna Wong, are you prepared to move your amendment?
Yes.
Seen it.
I don't know what else I'm supposed to do.
Well, you're supposed to move your amendment.
I'm happy. Okay, I move my amendment. Can the clerk put it up on the screen?
Speaker, on a point of order, it's
Yes.
John here.
Emeritori.
Just while we're looking for the amendment, I just want to make sure that everybody knows, because we're not meeting tomorrow, meeting Friday, but tomorrow is Councillor Ainsley's birthday. So I want all the best from all of us. He's looking better.
happy birthday.
Thank you, Speaker.
Happy birthday, Councillor Ainsley.
Thank you, Mayor Tory.
Happy birthday. Happy birthday.
Have a
Another
birthday.
pandemic birthday.
Okay, guys, the motion,
Get to council Friday.
Madam Speaker. Oh.
okay, hold on. Just one sec, please. Deputy Mayor Minna Wong, the amendment is on the screen. Can you please introduce it?
My amendment. Please vote for it.
Yes,
Finally.
The
Okay,
end.
okay, it's on the screen. You're going to introduce it correct? Okay, there you go. Okay, let's put the other amendment on the screen.
Why'd you take it away? Let us read it.
Oh, Councillor Cole, Like,
Thank you.
enough.
Oh, there's another one.
Yes.
Okay, Counselor Robinson's amendment is on the screen. On favor, show of hands, carried. Deputy Mayor Minnan-Wong's amendment on the screen, on favor, carried. Item is amended, on favor, carried.
Speaker, I have another one I can release.
Okay,
Well, I didn't release. It's member motion 28.20. I mentioned that I had Mr. Baxter asked for something else to go in there, and there it is. It's to add Chief Peg and Toronto Fire. General Manager, Toronto Fire Services, because it's one of the buildings that's right in the neighborhood.
What's the title of the?
it's MM 2820 pocket change. Okay, so
Pocket change plus.
Counselor Fletcher is moving the amendment, it's on the screen. On favor, show of hands, carried. Item is amended, on favor, carried. Thank you.
I
Yeah.
have another one, but I don't know if the amendment's up there yet. I did send it in, 19.10, IE 19.10.
IE 19.10, which is the Metrolinx projects.
Correct. I don't know if the center table has that.
Are you prepared to move the supplementary report?
Well, I'm moving an amendment to the main motion, but maybe it's not ready yet, so I'd have to do it Friday.
But you have to do
Madam
this.
Speaker, I have a question.
Okay, forget it. We're not dealing with it. Thank you. Counselor Robinson. Counselor Robinson, quick item.
I was going to release IE 19.12, active TO and accessibility, but I have a quick motion. Motion I want to move with it, which the clerks have.
Okay, so we'll put it on the screen, IE 19.12, active TO and accessibility. We'll put the motion is on the screen. On favor?
Yep.
Show of hands, carried. Item is amended, on favor, carried. Thank you.
You gotta let us read it.
Counselor Layton.
We have the right to read these things.
They're up already.
Screen for like a second.
Counselor
Are they
Layton.
not listed beside it?
Madam Speaker, and you've had every right to read my motion that's been up for the last couple hours. It's MM 28.35, 78 to 90 Queens Park, directions to staff, local planning appeal tribunal hearing.
Okay. Okay, Counselor Layton, I don't know what you just moved because that's not where we're at.
Sorry.
Okay, it's the member's motion that was added earlier, MM 2835. It's on the screen.
Hello?
Did everybody read this? Counselor Coe, have you read it?
Thank you for the time. I appreciate your indulgence allowing me to read it. Thank you.
On favor? Carried. I guess that's it for quick releases.
Motion is ready. I'd be happy to move it.
Pardon?
I had an urgent motion.
Questions on that?
Okay. All right, never mind.
We can't do that because we just introduced it 2 minutes ago.
Okay, if it was ready, I'd be prepared to move it, but that's
Yeah,
fine.
We just introduced it, Counselor Pasternak. We haven't circulated it. Okay. Is everybody else okay? May I have a motion to introduce the confirming bill?
So moved, Speaker. Counselor Fletcher.
Moved by Counselor Fletcher. We'll put the motion on the screen. Okay, if you can read it, Counselor Fletcher.
That leave be granted to introduce a bill to confirm to the point of the introduction of this motion, the proceedings of City Council meeting 28 on February 2nd and 3rd, 2021.
Thank you. Shall leave be granted to introduce this bill? All those in favor, show of hands. Carried. Shall this bill be passed and declared as a bylaw? All those in favor, show of hands. Carried. Okay, that carries. Some members, we will recess to Friday, 9:30. Okay, and thank you. I want to thank especially the staff that are here today. Thank you. It's been a very difficult day for all of us. Thank you. And thank you to members of council for your patience. We'll see you Friday.
Thank you, Madam
And
Speaker. We know we're terrible.
That was not an easy day.
Yeah.
Well,
Take care, be
Everybody
safe.
stay
happy
safe.
birthday, Paul. We all want a cake. We want a piece of cake on Friday morning, please. Paul Ainsley.
Happy birthday, Paul. Thank you.